Hello, and welcome to our second annual Prenatal-to-3 Research to Policy Summit. I'm Cynthia Osborne, and I have the privilege of directing the Prenatal-to-3 Policy Impact Center here at the University of Texas's LBJ School of Public Affairs. And we are grateful that so many of you have joined us to learn more about how we can build a stronger and more equitable system of support for our infants and toddlers and their caregivers. This year has been especially trying, as you well know, and our caregivers and families need support more than ever. Thank you to the policy leaders who have pushed forward over the past year to adopt and fund policies and programs to support early childhood. Also, thank you to the state agency leaders and staff who have worked to implement policies and programs to create a stronger and more equitable impact on families and their children. And thank you to the advocates who have worked tirelessly to educate us on the needs of children and caregivers and to constantly urge us to do what is necessary. And thank you to the scholars who have pushed the boundaries of science on child development, as well as rigorous evaluations of policies and programs to guide us on what works. And a special thank you to the educators and nurses and doctors and home visitors and counselors and specialists and therapists and everyone else who's been working on the front line to support families and children. You have struggled to care for others when it's been very difficult to care for yourselves, so thank you. Thank you also to my team who has done an immense amount of work to bring the summit to you, including creating the second edition of our Prenatal-to-3 State Policy Roadmap, which we are excited to share with you today. 2 years ago, we launched the Prenatal-to-3 Policy Impact Center, and the guiding principles of our work have always been that it's grounded in the science of the developing child, that we're committed to promoting greater equity, and we're guided by the most rigorous evidence that's available. Our purpose is to be a resource for state leaders who aim to ensure that all children have the opportunity to be born healthy and to thrive. The science is clear that the most important thing that we can do as a society is to ensure that all of our children are born healthy and raised in safe and stable, stimulating and nurturing environments and have limited exposure to adversity. And our goal continues to be to identify the most effective investments that states can make to foster these environments for infants and toddlers. Although we wish we could all be together in person this year, we are excited that so many of you joined us from all over the country. Thousands of you registered for this event, and in every state, including DC, is represented, which really speaks to the level of commitment across our country to helping infants and toddlers and their caregivers. We have an exciting program to share with you over the next several hours, and we're going to begin by sharing with you evidence on why we need to invest in infants and toddlers. Too many children in this country do not have the opportunities that they deserve from birth, and disparities in opportunities and outcomes are pervasive and persistent. Disparities exist based on socioeconomic status and geography, but they also persist based on race and ethnicity. And our policies must not only be effective at improving outcomes, they must also reduce disparities to truly promote greater equity. We will then invite you to explore our revised and streamlined Prenatal-to-3 State Policy Roadmap, which can be found at pn3policy.org/roadmap. And the roadmap is intended to provide solutions to reducing disparities in opportunities and outcomes, and to be a guide for states on how to build a stronger and more equitable system of support for infants and toddlers and their parents. We have an inspiring group of state policy leaders joining us today. Our first panel of speakers will share how their states have transformed their early childhood systems and made substantial investments in the health, safety, and education of children from birth. And I'll then provide greater details on the policies and strategies in the Prenatal-to-3 State Policy Roadmap. And I'm excited to share the immense progress that so many states have made over this past year. This time last year, we all feared that states would be slashing budgets and cutting benefits and programs. However, instead of moving backward, most states moved forward. We'll also illustrate for you how state policy choices affect the resources that families have available to provide for their children. We've created an animated video that spotlights the variation in resources across states that we're excited to share with you. And in our second panel, we're fortunate to be joined by elected officials from 4 states who are going to share information on their state's successes in moving policies forward and investing in infants and toddlers and their parents this past year. And finally, we'll share our plans for moving forward. The policies and strategies that we include in the roadmap are the most effective based on the currently available data. However, we continue to monitor and build the evidence base to learn more about what works to support infants and toddlers. And as we identify more effective policies, we will add them to the roadmap. So again, welcome and thank you for joining us today. And we look forward to working with you on your journey to ensure that all children thrive from the start. I'd like to begin by sharing with you why we created a Prenatal-to-3 state policy roadmap to guide states on how they can invest to make sure all of our children thrive from the start. As most of you know, the prenatal to age 3 period is the most rapid and sensitive period of development, and it sets the stage for all subsequent health and well-being. During this period, infant and toddler brains are forming more than 1 million neural connections per second. And their brains are expecting input from their environment to understand what language they'll speak, what's safe, what's scary, who to trust, and other things. Children born healthy and cared for in nurturing environments are set on a trajectory toward lifelong success. But infants and toddlers who live in extreme poverty, who suffer abuse or neglect, or who are exposed to chronic stress during this important developmental period may be harmed neurologically, physiologically, and emotionally. And the damage may have lifelong consequences for their physical and mental health, their social relationships, educational achievement, and employment and earnings. And based on this science of the developing child, we identified 8 Prenatal-to-3 policy goals. These goals include making sure families have access to the effective services that they need, that families can balance work and caring for their children, and that work pays so that families have sufficient resources, including adequate food and housing, healthcare, transportation, childcare, and other essentials. These resources reduce the stressors that many families face and empower parents and limit children's exposure to chronic adversity. In addition, children need to be born healthy to healthy parents who have the physical and emotional health they need to care for their children. Parents also need support in enhancing their parenting skills and knowledge of child development so that they can provide the nurturing environments that lead to more optimal brain and body development. As they say, children do not come with an instruction manual, and we can all use help. When children are not with their parents, they need to be in nurturing childcare environments, which means we have to care for all the caregivers who care for our children. Finally, as early as possible, we need to identify any delays in development that children experience and connect children with the services they need to get them on track toward lifelong healthy development. Unfortunately, not all children live in environments that create these conditions, and many children are exposed to chronic poverty, stress, and trauma from birth. Too frequently, it's children from lower socioeconomic statuses and children of color who are the least likely to have the opportunities they deserve during the earliest stages of development and beyond. For each of the 8 goals, we identified a set of outcome measures or indicators that illustrate how infants and toddlers are doing across all states. Too frequently, the well-being of our littlest ones differs systematically based on where they live, the income of their parents, and their race or ethnicity. And these differences are often shaped by state policy choices. And I'm going to spotlight 3 areas to illustrate the well-being of families and how they vary by state and race and ethnicity. I'm going to look at health, financial security, and nurturing environments. So beginning with health, mother's access to health insurance is vital for her own health, particularly during the perinatal period, and for promoting the health of her children. But in the US, over 23% of lower income women of childbearing age lack access to health insurance. And this number is much higher in states that have not expanded Medicaid. For example, here in Texas, nearly half of low-income women between the ages of 19 and 44 lack health insurance, which is the highest uninsurance rate in the country. These women would be eligible for Medicaid if the state expanded the program, but currently no childless adults are eligible for Medicaid, and parents have to earn less than 17% of the federal poverty level to qualify. For a family of three, this would be equivalent to earning less than $311 per month. By contrast, less than 4% of similar women in the District of Columbia lack health insurance. DC has not only expanded Medicaid, but it provides coverage to parents with incomes up to 221% of the federal poverty level, rather than the 138% that Medicaid expansion requires. And this vast disparity across states in health insurance coverage is a clear result of state policy choices. Uninsurance rates also vary considerably by race and ethnicity. In particular, Hispanic women are nearly twice as likely to be uninsured compared to other women. Another health indicator is access to quality prenatal care, which is linked to healthier birth outcomes and better health for the mother. However, nearly 15% of women in the US do not receive adequate prenatal care. And this ranges from a low of 5% of births in Rhode Island to nearly 25% in New Mexico. And the percentage of Black women who do not receive adequate prenatal care is 2 times higher than it is for white women. And this difference in access to adequate prenatal care is one of the drivers of the stark differences in birth outcomes between Black women and other women. For example, the proportion of Black babies born preterm is 50% higher than it is for other babies. And the rate of infant mortality among Black babies is twice the national average. Where a baby is born is also predictive of its birth outcomes. For example, babies born in Mississippi are nearly twice as likely to be born preterm and nearly 3 times as likely to die in the first year of life compared to babies born in New Hampshire. Again, these differences in opportunities and outcomes are largely the result of state policy choices. Disparities in economic security are also vast and highly correlated with state policy choices. The research is clear that experiencing poverty, especially in the earliest years, can have lifelong negative consequences on health, education, social outcomes, and so forth. And we find that children under age 3 in Mississippi are nearly 4 times as likely to live in poverty as similar children in New Hampshire. And Hispanic and Black children under age 3 are 2 and 3 times as likely to live in poverty, respectively, as compared to their white counterparts. A third example of the disparities that children experience from the earliest years is the percentage of infants and toddlers who lack the nurturing environments that science so clearly identifies as essential for healthy physical and emotional development. The data show that in the US, nearly 2/3 of children under age 3 are not read to daily, and more than 2 out of 5 infants and toddlers do not experience nurturing interactions, such as singing songs or telling nursery rhymes or playing peekaboo on a daily basis. And these numbers are nearly 50% higher for Black and Hispanic children as compared to their white peers. Parents who are stressed and financially strained may have more difficulty engaging in these behaviors with their little ones, and this can have serious consequences for children's healthy development. The most serious form of adversity that children can experience in this important developmental period is maltreatment. And in the US, approximately 16 infants and toddlers per 1,000 experience maltreatment each year. The rate for Black children is nearly twice as high as it is for other children, which could be partially explained by the serious stressors so many Black families face, or the documented higher rates of surveillance and removal of Black children in the child welfare system. The rate of maltreatment also varies considerably across states, from a low of 2.1 per 1,000 children under the age of 3 in Pennsylvania to 39.5 per 1,000 in West Virginia. It's very likely that these differences are driven largely by differences in the state's child welfare systems rather than only differences in exposure to child maltreatment, however. So these 3 examples, they illustrate the substantial variation in opportunities and outcomes for infants and toddlers beginning at birth The systemic racial and ethnic disparities and the disparities across states are largely the result of state policy choices, and they demonstrate the need for states to adopt and fully implement policies and strategies that will lead to enhanced and more equitable opportunities and outcomes in these earliest years.
My name is Kaylee Benson. I'm the Assistant Director at the Child and Family Research Partnership and the Prenatal-to-3 Policy Impact Center, and I am thrilled to be here to introduce our 2021 State Policy Roadmap and a little bit about why the roadmap is an essential tool. The Science of the Developing Child provides a clear picture of the conditions that infants and toddlers need to thrive. And unfortunately, we know that infants and toddlers' environments vary considerably based on where they live and other characteristics such as race and ethnicity, and that many of our youngest children lack the opportunities they deserve. In response to this clear scientific evidence and systematic disparities in opportunities and outcomes, we turn to the most rigorous evidence available to identify the most effective investments that states can make to empower parents and create the conditions that allow all children to thrive from the start. Based on comprehensive reviews of the most rigorous studies, we created the Prenatal-to-3 State Policy Roadmap, which identifies 5 policies and 6 strategies that, when combined, create a stronger and more equitable system of support for infants and toddlers and their caregivers. The 5 policies reduce the stressors many families face by providing broad economic and family supports to ensure that families have access to health insurance and adequate nutrition, that parents can balance work and caring for their children, and that work pays to allow parents to provide sufficient resources for their children. The 6 effective strategies help to enhance the capacities of families by providing more targeted interventions that address specific needs. These include programs that conduct comprehensive screenings and connect families to the services they need, subsidies to allow families to access affordable, high-quality childcare, group prenatal care, parenting supports, early Head Start, and early intervention services to address identified developmental delays. Previously, state policy leaders lacked information as to what the best investments are that they can make to support infants and toddlers. The State Policy Roadmap fills this gap and provides a tool for state leaders to help them develop and implement the most effective solutions to ensure all children get off to a healthy start and thrive. In addition to providing detailed information on each of the 11 effective solutions, the roadmap also tracks states' progress toward adopting and fully implementing each of the policies and strategies. Currently, there's a patchwork of benefits and programs for families across the United States. Where a family lives determines the resources it has available to support the healthy development of its infants and toddlers. Although all states can do more, especially given the strains that the pandemic has put on families, many states are making substantial progress toward implementing effective policies to support children and families. We recognize that changes to state policy often take time, and so in addition to indicating whether a state has fully implemented a policy, the roadmap also documents the annual legislative and administrative activity that occurs in each state toward the adoption and implementation of the 11 effective solutions. The primary purpose of the roadmap is to provide guidance to states on how to build stronger systems of support that lead to enhanced and more equitable opportunities and outcomes for infants and toddlers. To this end, the roadmap also tracks 20 outcome measures that allow states to understand how children in their state are faring over time across race and ethnicity and relative to other states in the U.S. Children are our most precious and valuable resource, and they all deserve the opportunity to thrive from the start. Unfortunately, many children are struggling. State policy choices can empower parents and promote the lifelong well-being of infants and toddlers. We are so excited to share with you today the second annual Prenatal-to-3 State Policy Roadmap. We will provide more detail of the content of the roadmap later in this event, but for now, we invite you to explore the roadmap on our website at pn3policy.org/roadmap. The focus of this year's roadmap is on the progress states have made this past year to support infants and toddlers. We heard your feedback on the first roadmap, and we tried to incorporate as much of it as we could in this new streamlined version of the roadmap. This short video provides an overview of how to navigate the roadmap and the information that it provides. Enjoy.
The Prenatal-to-3 State Policy Roadmap is a guide for state leaders to help them develop and implement the most effective policies and strategies that create a stronger and more equitable system of support for infants and toddlers and their parents. The science is clear. Children need to be raised in safe, stable, warm, nurturing environments, and state policy choices can help empower parents and promote these conditions. Based on comprehensive reviews of the most rigorous evidence available, the State Policy Roadmap identifies 5 effective policies and 6 effective strategies that help to create the conditions in which children thrive. In addition to providing guidance on what works, the roadmap monitors states' annual progress toward adopting and fully implementing these effective policies and measures the well-being of infants and toddlers in each state. You can explore the U.S. Roadmap, which provides a summary of all states' progress and well-being, or explore any individual state, including the District of Columbia, by using the drop-down menu or clicking on the map. The U.S. Roadmap begins with a summary page. It shows the number of states that have fully implemented each of the effective policies, as well as the states that are leading the way in implementing the effective strategies. Scroll down to see how the 8 science-driven Prenatal-to-3 policy goals align with the 5 effective roadmap policies and 6 effective strategies. Each column represents one of the 8 policy goals, and the shaded circles in each row indicate that the policy or strategy positively impacts that goal and enhances the well-being of infants, toddlers, and their parents. The framework also illustrates the outcome measures that are associated with each policy goal, which we are tracking over time. The summary page also provides a short definition of each of the effective policies and strategies, but detailed information for each of the 11 solutions is available in subsequent sections of the roadmap. In addition to providing information on what works, the State Policy Roadmap tracks states' progress toward adopting and implementing the effective policies. To date, 4 states have fully implemented all 5 of the roadmap policies, and another 15 states have implemented at least 3. Over time, the hope is that all states fully implement all 5 effective policies. The focus of this year's roadmap is on the progress states have made over the past year in implementing the effective policies and strategies. 5 states fully implemented at least one new policy this year: Florida, Massachusetts, Missouri, New Mexico, and Oklahoma. And Missouri implemented 2. In addition, the roadmap provides information on the legislative and administrative activity states engage in toward policy adoption. We know that policy change often takes time, and that progress is often made even if the policy is not fully implemented. Finally, the roadmap summary page shows how the opportunities and outcomes vary considerably for infants and toddlers across states. These measures help states to set priorities for where to begin to build a stronger and more equitable Prenatal-to-3 system of support. More detailed information is available for each effective policy and strategy, and you can select the one that interests you. Each policy profile begins with a snapshot of the policy goals that it impacts, the states that have fully implemented the policy, and a brief summary of the progress states have made toward adopting the policy in the past year. Each profile also explains in detail what the policy is and why it is important for supporting the healthy development of infants and toddlers. Additionally, the profile provides specific examples of the impact that the policy has on each of the policy goals. As stated earlier, the focus of the roadmap is on the progress states are making toward adopting and fully implementing each policy. In each policy profile, we illustrate the progress states have made between last year and this year, and provide a thorough discussion of the legislative and administrative activity states engaged in over the past year as they work to adopt the effective policies. We also recognize that changes to state policies don't always happen quickly, and that some states will consider policy changes for several years before adopting them, or other states will adopt a policy but take time to implement it. We provide a summary of where states stand regarding fully implementing each policy. Finally, in each policy profile, we provide a series of indicators to illustrate the variation across states in the generosity and reach of the policy. For each effective strategy, we provide similar information. We begin with a snapshot of the goals the strategy impacts. Because the research for strategies does not yet provide clear guidance on how states should implement the strategy, we list a small group of states that we consider to be national leaders in the strategy, rather than providing information on which states have fully implemented it, as we do for policies. For example, the evidence is clear that child care subsidies impact maternal employment and facilitate the use of childcare. However, to date, the evidence does not provide clear guidance on the precise level of reimbursement rate or copayment level states should set to allow parents access to affordable, high-quality care. Thus, subsidies are currently considered a strategy rather than a policy. Similar to the policies, each strategy profile provides detailed information on what the strategy is, why it supports the healthy development of infants and toddlers, and the impact that it has on each of the Prenatal-to-3 policy goals. The roadmap also provides detailed information on how each of the state leaders are implementing the strategy and discusses the policy choices states can make to more effectively implement and fund the strategy, and ensure that more children who are eligible for the services receive them. Again, the focus of this year's roadmap is on the progress that states have made this past year toward implementing effective solutions to strengthen the Prenatal-to-3 system of care. Therefore, each strategy profile shares detailed information on state progress. Finally, similar to the policy profiles, each strategy profile illustrates how the generosity and reach of the strategy varies across states. We invite you to explore over 100 indicators throughout the 11 profiles. You can also find detailed information on each of the outcome measures that are included in the roadmap. In the U.S. roadmap, the outcome measures are shown by race and ethnic group, and where possible, over a 5-year period, to allow for comparisons between groups and over time. The goal is to create a stronger and more equitable system of support for infants and toddlers, so we should see reductions in race and ethnic disparities in these measures as more states implement the roadmap policies and strategies. The final section of the roadmap provides information on the demographic characteristics of infants and toddlers and their parents. Where possible, the information is disaggregated by race and ethnicity. For detailed information on all of the data used in the roadmap and our sources, visit the Methods and Sources page. All of this information is provided in each of the state-specific roadmaps. However, the state roadmaps provide even more in-depth information on a particular state. The state's summary page provides a snapshot of the policies that state has fully implemented and indicates with a star the strategies on which the state is considered a leader. More detailed information on the legislative and regulatory actions the state took toward implementing each of the 5 policies and 6 strategies is also available in the state summary. And the state's outcome indicators are highlighted and ranked so that each state can measure how the well-being of infants and toddlers in the state compares to others across the country. The policy profiles also provide state-specific information, particularly on the state's progress toward adopting and fully implementing the policy. Similarly, for each strategy, the profile highlights the state's progress toward implementing the strategy effectively. The state's outcomes and demographic characteristics pages illustrate how the state compares to the U.S. The Prenatal-to-3 State Policy Roadmap builds on the science of the developing child and identifies the 11 most effective investments that states can make to empower parents and foster the conditions in which children thrive from the start. This guide for state leaders also illustrates the progress that states are making toward implementing the effective solutions, and it allows state leaders to monitor the well-being of infants and toddlers over time.
We are truly excited to share the new roadmap with you, and we welcome you to explore it. We hope that it's a useful resource for your state, and please know that my team and I are available to answer any questions you have, and we look forward to ongoing discussions. I also invite you to visit our Learn More page on the roadmap, which may help answer some questions that many folks often have, such as, what is the difference between a policy and a strategy? And how did you choose which policies and strategies to include in the roadmap? And why didn't my state get credit for what we're doing? And we've heard a lot of them, and we tried to answer them for you. But before we transition to our first panel, I want to take just 1 minute to give a special thank you to Dr. Benson for the amazing leadership she showed in wrangling our team to produce this roadmap. Every one of our team members stepped in big time, but with 11 policies and strategies, 20 outcome measures, over 100 policy indicators for 51 states, there was a lot of moving parts. And she kept us all organized and focused, and she has the spreadsheets to prove it. They are seriously impressive. So thank you, Kaylee. For our first panel, we are so excited to bring to you 4 states that have really transformed their early childhood systems. I had an opportunity to interview them, and I asked them to address why their state chose to prioritize investments in infants and toddlers, and to describe what they've done to transform their systems and the goals that they hope to achieve, the successes that they've had thus far, and the challenges that they've faced, and any insights that they would provide to other state leaders who are considering similar changes. I spoke with Kayla Hahn, the Chief Policy Officer to Governor Parsons in Missouri, and she discussed the creation of the new Office of Childhood, which consolidated early childhood programs across 3 agencies related to childcare, pre-K, home visiting, early intervention, and early childhood workforce supports into a single office. I also spoke with Elizabeth Grogensky, the Cabinet Secretary of New Mexico's new Early Childhood Education and Care Department, along with her colleagues, Giovanna Archuleta, the Assistant Secretary for Native American Early Childhood Education and Care, and Janice Gonzalez, the Chief Health Officer of the new department. The department is the 4th cabinet-level state early childhood department in the country. Additionally, I had a wonderful conversation with Jenna Conway, the Deputy Superintendent of Virginia's Early Childhood Care and Education Division. The division just moved from the Department of Social Services to the Department of Education to ensure that children who are using child care subsidies are in high-quality programs that lead to good outcomes. And finally, I spoke with Council Member Robert White from the District of Columbia. He worked alongside a group of council members to enact the Birth to 3 for All DC Act in 2018. This year, the DC Council made breakthrough progress by approving a budget that includes a 3% tax on DC's highest earners to provide nearly $75 million in local annual funding for the Birth to 3 law. We invite you to watch and learn more about how these states are thinking systematically to improve opportunities and outcomes for infants and toddlers. What they've accomplished is truly impressive.
I think the first is a long overdue recognition of how important brain development birth to 5 is, and how that has this potential to put kids on track for success, whether that's academic or social emotional or some combination of the two, but realizing that this can have a tremendous impact on kids, on their futures and their success, on families, and on so many of our other systems, from K-12 to our workforce, right? But today's early childhood population is tomorrow's workforce. The second is this fundamental understanding, and also long overdue recognition, that this is intentional learning and development, that early childhood is not a handout, is not babysitting, is not working simply to keep kids from harm, but is fundamentally, whether you're thinking about infants or toddlers, preschoolers, these are professionals who are working to support kids' learning and development.
We collectively understood the importance of the prenatal to 3 years in terms of development of children, lifelong achievement, health impacts, economic impacts. But we also understood the need for parents who need to get back to work and be a part of the workforce. So we have seen study after study that talks about the economic impacts of birth to 3 learning, the health impacts, the impacts on families, most importantly mothers, because they are usually the ones making the professional sacrifice to stay at home because of that cost burden of early childhood education, but also centers being able to survive and sustain and keep staff, and so they can professionalize.
Early childhood, we believe, is critical to workforce because if they're safe, if they're healthy, if they have educational opportunities early, we know that investments in early childhood have a very positive return long term. We knew that we were ranked 45 in early childhood governance by the Bipartisan Policy Center. That was also a sign to us that we may need to do something differently.
The stark reality of 50th in child well-being, which is where we were until last year, we're now 49th, and the 49th in child poverty are two very impressive, staggering statistics that I think have motivated this legislature and clearly our governor to say we've got to double, triple down. We've got to invest in what we know works. And I give so much credit to this state for recognizing the research that says if we invest early with high quality programs and services that are aligned and do support families, we can change this trajectory.
And we know that adverse experiences in early childhood can affect learning and interpersonal relationships and can cause chronic illness. So we already know in that sense that there's a connection. And that we need to look at health in a holistic way, not just physical health, but developmental health, mental health, and relational health.
The creation of the Early Childhood Education and Care Department was a 10-year process. It was something that came about, I think, because legislators, advocates, parents, providers all recognize the need to have a better and stronger coordinated system for prenatal to 5. And it was Governor Lujan Grisham who was able to get it across the finish line because she had a cradle to career vision for New Mexico. And she knew that investments in the early years were absolutely essential and critical to the success of this cradle to career movement. Our Lieutenant Governor, Howie Morales, when he was in the Senate, was the first to bring the first iteration of what has now become the department bill. And he saw it really as a call to action because there had been a significant lapse of federal funds at the department that handled childcare. And he didn't see it as a blame or somebody did something, but just recognizing again that issue that when you have such an important program embedded in larger departments, the ability to keep your eye on all the balls and make sure everything is going well was a challenge. And so he kind of used that as an impetus to say we need better alignment. We need to bring these programs and services together. Thanks to, again, the legislature passed the Land Grant Permanent Fund. It now goes to the votes of the people in November 22 to say, do the people of New Mexico want to take a small portion of the Land Grant Permanent Fund and invest that in early education? So these are 3 really important steps, one year after the next. I love that the governor said, we can't just create the department, we have to make sure we fund the work. Because while there was funding available, it was not enough to really change the trajectory. So she created the Early Childhood Trust Fund and worked with 2 key legislators to get that passed. I think it was unanimous passed and $300 million.
We were working with so many different agencies. We had 3 different agencies all working on either childcare or home visiting programs or social service programming for our kids. We also had all three agencies, Health and Senior Services, Social Services, and our Department of Elementary and Secondary Education all had home visiting programs. Several of our stakeholders and team members in the state kind of coalesced around an idea that had been talked about really for years, which is we need them to be able to access services from one agency. We need our providers to know that they can count on one agency, one office, and remove the fragmentation from our system. Last January, Governor Parsons signed an executive order creating an Office of Childhood in our Department of Elementary and Secondary Education. The Office of Childhood brought together 3 state agencies, and it became a consolidation of around 150 employees or state team members into one office. And the size of the budget for the Office of Childhood is just near or around $600 million. In the state of Missouri, it's one of our largest offices and divisions now across state government. So bringing those resources together really does show that we are really prioritizing early childhood and childhood programming.
We collaborated and put together and passed the Birth-to-3 for All DC Act, which became law, and now we have funded a substantial part of it. Birth-to-3 for All DC is a game changer of a law. It addresses several aspects of the early development stage. So we increase home visits for children and mothers and expecting mothers. We increase salaries for childcare workers, because even though they work in one of the most demanding fields and have to love absolutely what they do, they don't get paid enough to sustain a family themselves. In a place like DC, where we have already universal pre-K, this is a huge thing for families. We already see the payoff from that pre-K investment, and now we're looking forward to seeing the payoff from the 0 to 3 investment.
It's nearly impossible to move the needle on access and quality if you're not even unified in what you're trying to achieve. And so working from this true north of school readiness for all children, saying we've got to increase access, we've got to continually support the strengthening of quality. That means, from the top down, we've got to figure out how do we speak with one voice about health, safety, and learning, and then how do we align the expectations to enable our communities, our early childhood providers, and our families to be successful. And that's, in Virginia, why we have moved everything to the Department of Education so that we can better support our kids and families, our providers, our incredible providers across the state, as well as our communities, to devise the solutions that make the most sense for their kids, families, providers, and educators.
The ultimate goal that we are trying to achieve in DC is universal early childhood education. So when no parent has to pay a second mortgage in order to get their child into an early childhood education program, when every parent can find an open seat in our city that makes them happy, and no parent has to decide, am I going to pay for childcare or am I going to go back to work? That's when we know we will have reached our goal. And we're on the path to it.
The focus of the Office of Childhood would really be one vision, one team, one office, and comprehensive childhood programming. Moving forward, we want to streamline our home visiting programs and make sure that the services that are being offered in our state have some level of coordination and availability to all citizens, regardless of where they live. We want to make sure that there are regional hub offices that can coordinate all of these services for our families in different areas of the state.
At our core, we're focused on making sure that every child in the Commonwealth has the opportunity to come to school ready. And we think of that holistically in terms of some of those early academic skills, literacy and math, but as also those really important social, emotional, or soft skills. We believe in the potential of every child, and yet the adults, right, and the system we have built has failed to achieve that in a fair and equitable way for all Virginians. We know right now that just under half of our kids don't have the opportunity to come to school ready when we look at the Virginia Kindergarten Readiness Program. And all too often, things like socioeconomic background, the neighborhood in which you grew up in, other things are predictors when they shouldn't be, where we need to build a system that puts all kids, and I mean all kids, on track for success. So that's our true north. We know that none of this is about a test, though, of kids, that like really what it is about is two things. It's access and making sure that more kids and families have access to high quality experiences. We're so fragmented right now. We have different expectations, hard to work together. Sometimes we end up concerned with turf, right, because of what the different program expectations or the funding resources. And so we realized that we needed to be speaking with one voice at the state level to better support our providers and our communities. By bringing everybody together, inherently, it also forces you to think differently, right? And really, one of the things that goes along with our transition and moving everything together is also saying that we want to come up with a shared vision for what quality looks like and how we continually support improvement over time. It's less of a binary, yes or no, your quality. It's not based simply on a credential or ratio or a health and safety standard. We also understand that children are not autonomous beings, right? They grow up and they learn and they grow in the context of families and neighborhoods and communities. So I think the short answer is we think by building this really important infrastructure, both at the state and I'll talk in a second about the local level, then enables better connections.
We basically have these two systems, right? Early childhood system and the healthcare system that understand this and have similar goals and want to support children and families and help them thrive. But the two systems are not integrated. And not only are they not integrated, they aren't even really connected at this point. So it's more like you have three separate circles where you have the healthcare system in one and the early childhood system in one and the family and child in the middle, right? But it's not connected and it's not being provided to the family in a way that's coordinated. And so that's really our goal, is to try to bring those three circles together, to integrate those two systems, to coordinate the care that we're providing, because we're all touching the same families and the same children.
I want to highlight that the development of the chief health officer position really came out of listening sessions with our tribal partners. Through the needs assessment, we had the Native American Budget and Policy Institute do specific listening sessions. And so we published a separate document called Native American Perspectives. And that was one of their top priorities, was better integration of health and education.
I come from the Pueblo of Nambez, so I get to really bring my vision, my thoughts, my own lived experience, and my, growing up in a Pueblo to the table. And I think that when we look at our government to government relationships, it is critical that we have those ongoing consultations. It's critical that we meet the vision of each tribe, Pueblo, and nation to support their prenatal to 5 population. And they all have some strong services. It's just coming in and supporting any gaps that they see they may have from our department.
It takes a few years. I've now done it in 2 states, both Louisiana and Virginia. You have to listen to the folks first on the ground, really hear from programs. So in both states, doing listening sessions and getting out there and hearing from our stakeholders, those who are closest to kids and closest to families. It's a lot to move government. And so really thoughtfully making sure you're clear on your true north and why you're doing this. Because there's a lot of ways to organize government, and nobody gets excited about just moving parts of government. But if there's an overall compelling rationale, you can really get people behind it. And then it just takes the kind of painstaking work of saying, this is a sector that at its core either deserves its own agency or really should be recognized as education, right? These are professional educators. These are not babysitters. These are not workers. Again, regardless of the setting in which you're operating, we need these education professionals to really support learning and growth for our infants and toddlers and preschoolers. And we should organize ourselves in government to support that.
Creating an Office of Childhood certainly came with a set of challenges. Some of our biggest challenges were coordinating 150 team members into a new office, creating a new leadership structure internally, making sure that when this all happened, resources would be ready for providers and families on day one of a transition, making sure that our state budget aligned with the reorganization, making sure that our members in the General Assembly, our families, our provider community, our home visiting entities, making sure that they knew why we're doing this was also a challenge.
Well, the first challenge we faced was the global pandemic. Because we weren't even a department yet when the pandemic hit. So that made all of our work, I think, more challenging, but in some ways it really shined a light on the value of having all these programs and services together. I think it was very challenging for the staff who had to move to different departments, move into a different set of cultural norms and help create that in the midst of that pandemic.
And that's another one of the challenges that we have here, is that the programs that we brought together into this department all had different IT systems that they worked off, right? And home visiting and early intervention and families first all had completely different systems. So one of the things that we're definitely working on is a plan to try to better integrate those systems.
There were significant challenges in drafting, passing, and funding the Birth to 3 for All DC bill. The first challenge was trying to figure out how we get these levers right. What is the right pay scale for early childhood educators who are very much like our pre-K teachers in our schools, but not exactly like them? And so what is the right pay scale to implement? That was a big challenge. The other big challenge is, how do I get this issue prioritized above all the other big ideas moving in the city at once? And the way to do that was to make sure we made the case so people understood the impact on families, the impact on the economy, the impact on education, the impact on equity, but also bringing the right people to the table. So not just early childhood education experts, but also economists in our Chamber of Commerce, getting them on board. And then the last piece, which really was difficult, is funding. This is a wildly expensive effort. We are talking about dozens of millions of dollars a year. And Washington, D.C., like every other jurisdiction, has a limited pot of money that we have to make sure we are operating every other aspect of the government at the same time. So getting this funded turned out to be a huge challenge.
I'm happy to report that reorganization went into effect August 30th. We've already made great progress in streamlining our regulations, in bringing together our child care providers under one umbrella, and providing resources and information at one website. So these are all things that really drive at making it easier for providers, for families and kids to access resources.
We're making a big investment in these observations. When we did something similar in Louisiana, I had infant teachers come up and talk to me, and I was expecting them to say, why are you sending people in? Why are you don't trust me? And it was the opposite. They said, I've never had somebody come into my classroom and observe me. I've never had somebody talk to me about anything other than health and safety standards, right? So I worry about all these steps of diapering and I'm worried about messing up here, but nobody's ever come in and say, you do a really good job talking to your babies all day, or you do a really good job of scanning the room and noting when an infant needs your help, right? That's awesome. You do that well. These are your strengths. And here are some areas in which you can improve. And so building a system that measures something, and again, that's not a credential, not a cost factor, but really supports all of our educators, all of their strengths, and all of their opportunities for growth, and then moving the ecosystem around our educators to then focus on individualizing those supports.
The successes so far that make me proud are that one, we got the car on the road. We were able to create a minor tax to create a dedicated funding for birth to 3. The other thing that I would say is a success, an early success, no doubt, but hearing from early childhood education operators and teachers about their excitement for the investment in their field. So we all kind of see the future together now, and that's a really exciting thing. There are few tools more powerful than hope, and right now we have a lot of hope.
I think it comes down to the cohesion. I mean, we have all of these programs under one agency where we can communicate clearly. We can have responsive opportunities anytime an issue arises. We can work together. Whereas, when we were separate, it took some time.
We're a seat at the cabinet table. So as issues are being discussed about families' well-being, their self-sufficiency, the health of our communities, the Early Childhood Education and Care Department is sitting there both as a supporter and being able to advocate for the needs of families with young children, but also to listen and hear what are some of the other initiatives and activities that are happening across the cabinet that we can bring to our work. We have heard directly from community members. I'm seeing home visiting and early intervention working so much more closely. I mean, they're sitting down at bureau meeting, division meetings together, talking about opportunities in the community that they're each seeing, and they're able to problem solve together.
There are a couple really important equity goals here. The first is education. In DC, we have a great public school system, but the gap between children of color and white children in our public school system is still incredibly wide. The research shows us that if we do a better job of educating more of our children in the birth to 3 years, when their brains are growing and developing and setting the foundation for the rest of their lives and the rest of their academic careers, we can start to close that gap earlier. But there's also another equity piece here, which is parents who have to make that decision as to whether they have to leave the workforce because they can't afford childcare or can't find it, and those who get to stay in the workforce and grow in their careers. We still see in DC a racial gap between the folks who have to leave their careers and the folks who don't. And so we are closing both of these equity gaps as we create expanded early childhood education opportunities.
Something unique was the creation in our department, though, of an assistant secretary for Native American early education and care, which has been so critical to really changing the trajectory in our state for young children, our Native American children. State level data integration projects, one's called Health and Human Services 2020, and it's about better improving the customer experience so that as they engage with us as health and human service agencies, it's more aligned and streamlined. New Mexico longitudinal data system, which is being led by the higher education department, and we're with the workforce solutions and the public education department. So that's the cradle to career really able to understand how we're supporting children along the educational trajectory, along the educational pathway. So where we can connect data and understand, hey, we implemented a policy, how can we look at it more quickly to see, are we seeing changes in outcomes? Are we seeing better results? And then the other thing that we're doing as part of our commitment through our statewide strategic plan is we're developing a family survey that we're going to go statewide in multiple languages and multiple modalities to understand if families know about our services, if they do, have they ever used them, and if they have used them, what has their experience been with those programs and services. And so we're hoping to get that issued this year and then use it as an annual opportunity to measure our effectiveness as a prenatal to 5, prenatal to 3 system from a family perspective.
I just don't want us to forget too about spiritual health. I think that is critical in the tribal communities, and being that, families have been here for generations, hundreds of generations, and spiritual health has been relied on and supported in that prenatal to 5 stage with our babies.
Our first premise is that if there's a public dollar going to a program, we want to understand what is happening in those classrooms. And that's a really important premise. Yes, it's about accountability, but it's deeper than that. From an equity perspective, we know that our public dollars support some of our most vulnerable kids and families. And so understanding what they're experiencing is really important, right? To support them to grow and to support them to support kids' learning and development. And so that's a really important shift to say we're going to be okay, as Virginia was, with an optional measurement and improvement system, to saying now if you receive a public dollar, we care about what those kids are experiencing, and we want to work with you to improve that. We in Virginia we've passed this law, right, that will require us to measure what's going on in all of these programs. We want to get to every classroom multiple times a year and to be able to track over time when kids get access to this experience, what happens. And so we've built what's called Link B5 here in the Commonwealth, which is a first of its kind of trying to both capture the full inventory of classrooms across all of these settings, to then get information about the educators and then to affiliate those quality indicators with those classrooms. We're now adding classroom lists so we can understand where kids are being served. And ultimately, we'll be able to connect that back to our kindergarten readiness results, which we're now capturing for 4-year-olds and 3-year-olds. But it will enable us to kind of understand not only what experiences are predictive of success, but actually to start to capture growth over time. The big challenge here is getting every single site and every single educator to enter data is no small feat, right? And that is huge. And you need that in order for this to be accurate and meaningful information. And so our communities in the Commonwealth, with the support of our research and technology partners, have slowly but surely done that, helping people understand. We made it a little easier by attaching an educator incentive to our quality measurement system. And so we piloted with an educator incentive that was for all of our early childhood sector teachers who work with publicly funded kids.
W. Deming said, every system is perfectly designed to get the results that it gets. And right now in New Mexico, our prenatal to 5 system is not giving us the results that we know we want and that we know we can get. But it's going to take targeted investments, strong alignment, and the engagement of our communities, our families, and the providers who serve families. So that's what we're excited about.
This reorganization is not a quick, easy fix. It's a long-term play. We make these time investments now. They might not pay off for 15 or 20 years. But we know that someone has to do it, and we have to start now.
The one line I say, and I have to get it in here, is, and every time I present publicly, there is not a single provider or provider type in any state in this country or across our country who can serve all kids birth to 5, right? So we all have to come together to the table and say, we got to work together to do this, right? And that, I think, is such a important guiding principle, but it also forces you to think about this with some humility, right? And to kind of recognize that we're just going to do some of these things differently. But if we can agree on the most important things and support those, that's a key piece. We have to keep that true north in mind. It is a pain in the butt to move pieces of government. But if we keep that vision in mind, if we recognize that we are building maybe the most innovative systems out there, and we have this incredible upside in terms of kids' learning and development, I'm really excited about this. I'm also really excited because I think we can chart a path forward for early childhood educators that can be inclusive, right? That can recognize the different ways and the different competencies of adults that, to sort of support our kids' learning and development. It doesn't have to be as binary as simply a teaching license.
There are a couple words of encouragement that I would pass on to others. One is to know that you're not alone. This is a bipartisan national issue where all of us are struggling at different, points of success, but all of us are struggling to figure it out. And there are some incredibly passionate people in every single legislature across the country, because I've met and worked with many of them. You don't know who's a Democrat, who's a Republican, who's a Libertarian. A lot of people focus on early childhood education, knowing together how important it is. The other point of encouragement I would make is that we don't have to study anything else. The studies have been done. They are clear, they are conclusive. So all we need to do is make sure we get the information to our friends and colleagues in our jurisdictions around the country and start making the case.
Wow. What those state leaders have accomplished to support the earliest years is truly amazing. And I'm grateful that they've all shared their stories with us. We all have so much that we can learn from them. So far during the summit, we have shared with you why we need a Prenatal-to-3 state policy roadmap, because we know that the most important thing that we can do is to ensure that all children are born healthy and raised in nurturing environments. But we also know that not all children have the opportunities that they deserve. And we see systematic differences from birth based on children's race and ethnicity and where they live. And state policy choices influence these disparities and opportunities. Kaylee also introduced our new roadmap to you, and we hope that you've taken a moment to begin to explore the roadmap that we've created that identifies the most effective investments that states can make to foster the environments that science tells us are necessary for infants and toddlers' healthy brain and body development. And the 5 policies and 6 strategies that we outline in the roadmap combine to create the system of support to empower parents and allow children to thrive from the start. So now I'd like to share with you more about the roadmap, specifically the impact that the policies and strategies have on improving outcomes for infants and toddlers and their caregivers, or more about why these solutions actually matter, as well as detailed information on how the effective solutions are being implemented across the states. In particular, I want to highlight for you the substantial progress that many states have made over this past year. 5 states have fully implemented at least one of the roadmap policies for the first time this year, and Missouri implemented 2. But these impressive achievements are just really the tip of the iceberg. State leaders were actively pushing policies to strengthen families. And the momentum across the nation to support the prenatal-to-3 period is strong, and it provides me with hope that we'll finally prioritize children in their earliest years. So this roadmap framework illustrates how each of the evidence-based policies impacts the prenatal-to-3 policy goals. The 5 policies that are included in the roadmap provide families with the broad economic and family supports that they need to provide for their children, and they also positively impact children's health and well-being from birth. So the policies include expanding income eligibility for health insurance through expanding Medicaid, which leads to healthier birth outcomes and reduced financial hardships that are caused by out-of-pocket healthcare expenses. Currently, 39 states have expanded Medicaid, which extends the income eligibility threshold for adults to qualify for Medicaid to 138% of the federal poverty level. And in non-expansion states, no childless adults are eligible for Medicaid, and income eligibility thresholds for parents range from a low of 17% here in Texas to 100% at the federal poverty level in Wisconsin. This past year, Missouri and Oklahoma expanded Medicaid, which allowed nearly 500,000 more people to access the program for the first time, which we know is especially important during this year of COVID. Even more heartening is that 11 out of the 12 states that have not yet expanded Medicaid introduced legislation or tried to launch a ballot initiative to expand it this past year. However, despite a strong incentive from the American Rescue Plan for non-expansion states to expand Medicaid, none of the 11 states was successful. Reducing administrative burdens to allow families access to the benefits that they are eligible for is one of the simplest and most cost-effective policies that states can implement. We use the example of SNAP, which is the most effective nutritional program that we have in this country. A family of 3 with an income below 130% of the federal poverty level can receive over $500 a month in SNAP benefits to spend on food. And nearly a quarter of children under the age of 3 live in households that receive SNAP. But what's troubling is that almost 12% of households who are eligible for SNAP don't receive it. And this lack of access varies substantially across states. So research shows that states can implement a bundle of administrative policies to increase participation among those who are eligible. Specifically, states can extend the recertification interval to 12 months. They can allow for simplified reporting so that families only have to report income changes that will affect their eligibility, and they can provide all the services online. And currently, 26 states offer this combination of policies to reduce the administrative burdens that families can face in accessing SNAP. This past legislative session, Texas introduced a bill to extend their recertification interval from 6 to 12 months, but the bill didn't pass. And in Minnesota, they codified their 12-month recertification interval into law this year. But other than that, there was very little legislative or administrative activity related to SNAP. A paid family leave program that provides a minimum of 6 weeks of paid leave from work following the birth, adoption, or placement of a child in foster care increases the likelihood that the parent will return to work. It increases household income and reduces poverty. And access to paid leave also improves the mother's physical and emotional health. It increases the bonding between the parent and the child, and it leads to improved child outcomes, including reductions in trauma. Currently, 6 states offer a paid family leave program of at least 6 weeks. And this includes Massachusetts, who began offering 12 weeks of paid leave to new parents for the first time in January of this year. New York extended its 10-week program to 12 weeks beginning this year. And New Jersey and Washington also offer 12 weeks. New parents in California and DC have access to 8 weeks of paid leave. 4 other states have adopted policies that will take effect in the next several years. For example, this past year, Rhode Island voted to expand its 4-week program to 6 weeks beginning in January of 2022, and then to 8 weeks in 23. Connecticut will begin offering its 12-week paid leave program next year. Oregon will offer its program in 23, and Colorado is scheduled to begin providing 12 weeks of benefits in 2024. And what's exciting is that 23 states introduced legislation this year to adopt a paid family leave program of at least 6 weeks, and 19 of these states sought a 12-week program. And this level of legislative activity really demonstrates the strong desire for this effective policy across the country. And we'll wait and see if a federal program is signed into law. And currently, that would provide families with 12 weeks of paid leave beginning in July of 2023. A state minimum wage that's at least $10 an hour not only increases household resources and reduces poverty, it also leads to healthier birth outcomes. It leads to lower levels of neglect and improved health outcomes for children, and those outcomes have beneficial impacts throughout their school years. Currently, 22 states have a minimum wage that's $10 or greater. And this includes Florida, Missouri, and New Mexico that all crossed that $10 threshold this year. 3 additional states, Delaware, Nevada, and Virginia, will have at least a $10 minimum wage next year. 9 states have a state minimum wage that is above the federal minimum of $7.25 an hour, but not quite to that $10 level. But many of these states have scheduled increases to raise their minimum wage in future years. Today, the District of Columbia is the only state that offers a minimum wage of more than $15 per hour. But California is scheduled to increase its minimum wage to $15 next year, and at least 10 other states have increases scheduled to reach that threshold by 2026. In 20 states, the minimum wage remains at the federal minimum, which has not been increased since 2009. But interestingly, each of these 20 states introduced legislation this year to adopt at least a $10 minimum, but unfortunately none was successful. Finally, a state-earned income tax credit that's refundable and at least 10% of the federal EITC substantially boosts employment and household resources, and it also reduces disparities in adverse birth outcomes. 18 states currently have an EITC that's at least 10% of the federal EITC, and Indiana and Washington will join these states next year. The generosity of these states' benefits currently ranges from 10% in Nebraska and Colorado up to 45% of the federal credit in Maryland. And 5 of the 18 states that are already over the 10% threshold voted to expand their state EITC benefits this year. 4 other states adopted legislation this past year to offer a state EITC, but the benefit levels are less than 10% or they're not refundable. And 11 other states considered but didn't pass legislation for a state EITC. But altogether, 36 states introduced EITC legislation, which speaks to the broad support that this effective policy has across the country. One important note is that we are not advocating for any particular policy or benefit level. We set these minimum thresholds for the policies based on the most rigorous evidence that's available to date. But as states begin to implement more generous paid family leave programs or higher minimum wages, for example, we'll be able to determine the impact that these expanded benefits have on prenatal-to-3 outcomes, and then we can update the roadmap accordingly. The 6 roadmap strategies provide more targeted interventions for families to ensure that their specific needs are addressed. The difference between a policy and a strategy is that the research provides clear guidance as to what states should do to reap the impacts of an effective policy. For a strategy, however, the evidence is clear that it improves prenatal-to-3 outcomes. It works, but the evidence does not yet provide clear guidance on how states should implement or fund the strategy. So for strategies, we do not indicate whether a state has fully implemented it or not with a yes or a no, the way we do with policies. Instead, we've identified a handful of states for each strategy that we call leaders or states to watch because they're serving more eligible families relative to other states. They're using innovative funding mechanisms for the strategy, or they've made substantial investments in the strategy. We recognize that there are a lot of states doing innovative things, and we try to capture these initiatives in the roadmap, but we also know that we have more to learn. One effective strategy is comprehensive screening and connection programs. These programs are effective at identifying the specific needs that a family has and connecting the family to the services that will help them to meet those needs. The 3 models that have been rigorously evaluated are Dolce, Family Connects, and Healthy Steps. And some combination of these 3 effective models are available in 28 states. Although to be fair, in most states, a relatively small number of families have access to these programs. In this past year, New Jersey and Connecticut passed legislation to implement the Family Connects model, joining Oregon as one of only 3 states that plan to implement this program statewide. The Family Connects model greets new parents in the hospital right at the child's birth, and it offers a home visit by a nurse approximately 3 weeks later to assess the family's needs and to link them to the services that they need. Also, this past year, Maryland and California made substantial investments in the Healthy Steps model, which supplements the child's pediatric well visit with a developmental specialist who assesses the needs of the family and makes sure that those needs are addressed. Several states offer their own alternative model to screening families and connecting them with services, which seems very promising. And we're hoping that the program models will be rigorously evaluated to provide more options to states. Child care subsidies provide an essential resource to families to help them to access affordable child care. And research shows that higher subsidy reimbursement rates increase employment and lead to greater stability in child care arrangements. But too frequently, reimbursement rate levels are set below the amount that would be necessary for families to access high quality care or for child care providers to pay their teachers a living wage. State leaders in child care subsidies set their reimbursement rates at levels that cover the true cost of care, and they have reasonable expectations of what the family can pay in copays. The combination of these two policies lead to families being responsible for a relatively small percentage of the overall price of care. This past year, Oregon, Rhode Island, and Washington enacted bills to cap family copayments at no more than 7% of income. And Vermont passed legislation to ensure that families with incomes below 150% of the federal poverty level do not pay copayments. Washington's legislation also increased reimbursement rates. It implemented an infant care rate incentive, and it will develop a cost model for care rather than merely relying on a market rate survey. New Mexico and DC also use a cost model to determine a truer cost of providing care that takes into account adequate teacher salaries and appropriate staffing to ensure quality care. Unfortunately, in many states, the reimbursement rates are set considerably below the market price of a region and even further below the true cost of care, leaving parents responsible for making up the difference or seeking lower quality care. And co-payment rates vary a lot. For example, for a family of 3 with an income of 150% of the federal poverty level, the copayment would be 0 in South Dakota and Utah, but it's over 30% of a family's income in Hawaii. In 7 states, families with this income level will be responsible for about half of the total child care bill. For more information on child care subsidies, I encourage you to check out all of the graphics in the child care subsidy profile in the roadmap. We recognize that many states have updated their reimbursement rates as of just October 1st, and we will update the information over time to reflect these changes. And for now, though, the information in the roadmap was all current for all states as of July 1st. Group prenatal care typically serves pregnant people with low-risk pregnancies who don't require individual monitoring. The groups include up to 12 people of similar gestational age and who meet every 2 to 4 weeks, totaling up to 20 hours in prenatal care over the course of their pregnancies, compared to only 2 to 4 hours in traditional individual care. 9 states provide an enhanced reimbursement for group prenatal care through Medicaid to encourage doctors to offer the approach, and these enhancements range from $7 up to $50 per person per visit, depending on the state. Birth outcomes are typically the same in group or traditional models, but pregnant women are more likely to receive adequate prenatal care, and they benefit from the social inclusion of the model, which leads to better perinatal mental health outcomes. The centering pregnancy model is the predominant group prenatal care model and the model that's been studied the most rigorously. And services were somewhat disrupted during the pandemic, but in 2019, women could access centering pregnancy in 46 states. And the number of women with access is relatively low, however, ranging from less than 1% of births in Arkansas and Tennessee to over 14% in DC. 3 states, Maryland, Illinois, and Ohio, took legislative or administrative action this past year to expand access to group prenatal care services with the hope of creating enhanced and more equitable perinatal opportunities and outcome. Given the critical role that parents play in shaping children's early development, improving parents' knowledge and social support and coping skills, as well as connecting families to community and health resources during the prenatal and early childhood periods through evidence-based home visiting programs, promotes positive long-term child development. Teaching parents the skills for warm and responsive caregiving can buffer the long-term negative effects of childhood stress and adversity. States can choose from 7 home visiting models that are designed for pregnant women or for infants and toddlers, and the models that have a significant impact on improving parenting skills. On average, approximately 7% of eligible families are served by these models, but this varies from less than 1% of eligible families in Nevada to over 35% in Iowa. And although most funding for home visiting programs comes from the federal McVie program, states use a variety of funding mechanisms to supplement the federal dollars. In particular, 23 states use Medicaid to fund components of home visiting services, including Illinois, that passed a law this past year to expand the use of Medicaid to fund home visiting as part of a larger health equity initiative in the state. Early Head Start is a federally funded program that serves pregnant women and infants and toddlers and their caregivers in families with lower levels of income. In rigorous evaluations, the program has been shown to promote healthy social, emotional, cognitive, and physical development in young children, to also assist parents in developing positive parenting skills and moving toward their self-sufficiency goals, and to bring together community partners and resources to provide families with the comprehensive services and support that they need. Across all states, the estimated percentage of eligible children with access to Early Head Start ranges from less than 4% to over 31%. And although access is typically driven by local grantees within a state, by providing supplemental funding to Early Head Start, states can increase the share of eligible children with access. The 7 state leaders support Early Head Start by contributing state-level funding or adopting and funding a state-based program with a structure and quality standards that are very similar to Early Head Start. Nebraska, Illinois, Oregon, and Washington all have state-based programs that build on Early Head Start standards, but expand the program to more families. Over the last year, Maine, Oregon, and Washington all passed legislation to further invest in expanding Early Head Start programs. Finally, early intervention, sometimes referred to as Part C, offers services for infants and toddlers who have disabilities or developmental delays, regardless of a family's income. And the most rigorous evidence suggests that early intervention services can improve young children's cognitive development, language and communication skills, behavior and motor skills, and reduce the children's need for services as they get older. State EI programs vary considerably in the percentage of children under age 3 who are served, and they also vary in their eligibility criteria, the funding streams that states access to support the programs, the level of collaboration between Part C programs and other state agencies such as Medicaid and child welfare, and in other ways that have implications for the strength of the state's program. The share of children served is one of the only indicators that allows for a consistent, meaningful comparison of states' EI programs. In most other ways, states' programs are so different and context dependent that it's difficult to compare them to one another. National research suggests that the prevalence of children under age 3 with delays and disabilities whose development could actually improve with EI services is somewhere between 13 and 20%. But recent national data show that just over 7% of children in the US under age 3 received any EI services over a 12-month period. But this percentage varies considerably by state, from a low of approximately 2% in Arkansas to a high of 22% in New Mexico. Massachusetts is another standout state in the percentage of children served, with over 20% of infants and toddlers receiving EI services over the course of a year. Experts suggest that states should maximize use of Medicaid to fund services to expand access to EI. Several states passed legislation this past year to expand access to EI. For example, Delaware passed a bill that will require child care providers to ensure that children between the ages of 0 and 5 are screened to identify developmental delays and any socio-emotional needs that they have. Delaware also changed the agency that administers its EI program in an effort to provide a more seamless transition for infants and toddlers from Part C services to 3 and 5-year-olds in Part B services while they're in pre-K. And both programs are now housed under the state's Department of Education. Additionally, Illinois passed legislation to allow toddlers who turn 3 during the summer to continue to receive EI services until the school year begins. And Connecticut passed legislation that eliminated the collection of family fees which will expand access to services for lower income families. So as you can see, there was a lot of activity within states this past year to adopt policies and expand benefits available to families to help to empower parents and to ensure that children get off to a strong start and thrive. And I hope this momentum is motivating to other states because there is still so much more that needs to be done. 4 states, California, the District of Columbia, Massachusetts, and New Jersey, are implementing all 5 of the effective roadmap policies. And at least 3 additional states, Connecticut, Rhode Island, and Washington, will join this group next year. However, there are 7 states that have not implemented any of the effective policies yet, and another 12 states that have fully implemented only 1. And so families in these states lack access to benefits and services that could enhance their opportunities to care for their children. I only scratched the surface of the information that's available in the roadmap, and I encourage you to use it as a resource as your state develops and implements policies to build a stronger and more equitable prenatal-to-3 system of care. Remember, the most important thing that we can do is to make sure that children experience nurturing environments in these earliest years with limited exposure to adversity. These environments set the stage for all subsequent health and well-being. And state leaders now have the information on the most effective investments that they can make to foster these environments. These state policy choices can have lifelong benefits for the child, for the family, and for society.
I think the first is a long overdue recognition of how important brain development
The prenatal to age 3 period of development lays the foundation for all subsequent health and well-being. The brain is forming more than 1 million neural connections per second during this period. Sufficient resources for parents to spend on food, housing, transportation, childcare, and healthcare are essential to provide infants and toddlers with the opportunities they need to get off to a healthy start and thrive. The level of resources a family has varies substantially across states based on the state's policy choices. This is Lena. Lena is a single parent to a 3-month-old and a 2-year-old. Lena and her children live in Kansas, where Lena works full-time and earns the state's minimum wage of $7.25 an hour, or just over $15,000 per year. This level of income leaves Lena and her children living in poverty despite working full-time. Kansas provides a subsidy to Lena's childcare provider that covers nearly all of her childcare costs. In Kansas, Lena is also eligible for several other benefits such as SNAP and WIC, both of which help to offset the cost of groceries for her and her children. Once a year, Lena is eligible to receive federal tax credits, and Kansas supplements the federal credit with a refundable state-earned income tax credit. In Kansas, Lena is not able to receive Medicaid because Kansas has not expanded access to the program, leaving Lena responsible for her healthcare costs. She also does not have access to paid family leave and had to return to full-time work shortly after her baby's birth. After paying childcare expenses, Lena's earnings plus federal and state benefits leave her with just over $2,500 a month to pay for housing, food, healthcare, transportation, and other essentials for her family of 3. But what if Lena lived somewhere else? In neighboring Missouri, Lena's resources would be very different. The minimum wage in Missouri is $10.30 an hour, or more than $21,000 per year. This is more than 40% greater than what Lena earns in Kansas, but is still below the federal poverty level for a family of 3. In Missouri, Lena's access to childcare subsidies and other benefits changes too. Although she does receive a childcare subsidy, the cost of care in Missouri is higher and the state's benefits cover only a fraction of her childcare costs, leaving Lena responsible for almost half of the cost of care for her 2 children. Although Lena benefits similarly from SNAP, WIC, and federal tax credits, unlike Kansas, Missouri does not have a state-earned income tax credit. Lena does have access to Medicaid because Missouri recently expanded access to the program, but she did not have paid time off after her baby's birth because Missouri does not offer paid family leave to all workers. After childcare expenses, Lena is only left with approximately $1,800 each month to provide for her family, over $700 less per month than what she would have in Kansas, despite higher earnings. In either state, Lena is working full-time at a minimum wage job, while her children stay in full-day childcare. But policies in each state yield substantially different outcomes across the U.S. States make policy choices that impact the resources families have to provide for their children. The differences we saw between Kansas and Missouri exist throughout the country. Between states in the north, in the south, in the east, and in the west. Lena would have the most resources available for her family after childcare expenses in the District of Columbia, with approximately $3,500 each month, as well as access to Medicaid and universal paid family leave. If Lena and her family lived and worked in North Carolina, the state's policy choices would leave them with the fewest resources in the U.S. and about half of the available resources they would have in D.C., at just under $1,800 each month to cover all of the family's non-childcare expenses, including her healthcare costs. States vary in the minimum wage parents earn, whether the parent is eligible for Medicaid, has paid family leave, receives state tax credits, and in the amount of childcare subsidy available. These policies can work together to create a system of support to allow parents to care for their children and help their children succeed. The Prenatal-to-3 state policy roadmap details the most effective policies that states can implement to ensure all children have the opportunity to get off to a healthy start and thrive. Visit pn3policy.org to learn more.
We developed this animated video to illustrate how state policy choices interact to create a system of support for parents and their children. And when we combine the roadmap policies and strategies for each state, we see that the level of resources that a family has available to meet their basic needs varies substantially, from over $42,000 per year in DC to less than $22,000 in North Carolina. And our analyses show that state minimum wage policies and childcare subsidy policies are what really drive most of this variation. So let me explain what we did to get these numbers. Let's use the example of Kansas and Missouri that we used in the video. We chose a stylized family of a single mom who has an infant and a toddler, and she works full-time all year at a minimum wage job, and she leaves her 2 children in center-based childcare. Also, an assumption for our simulation is that the child care center charges a price that is at the 75th percentile of the market. The 75th percentile means that 75% of child care providers charge a lower price and 25% charge a higher price. And the federal government recommends that states set their reimbursement rates at the 75th percentile because that is considered to be an equal access target for affordable, high-quality care. But other research by Simon Workman suggests that for many states, the 75th percentile of the market price is substantially below the true cost of providing quality childcare. However, most states currently use the market rate price in setting their reimbursement rates. So for the simulation, we're using that so that we're consistent across all states. Just one other note on childcare subsidies, in case anyone watching is like I was before I started doing this project a few years ago. when I thought I did, but I really didn't understand how subsidies work. So states set a base reimbursement rate, which is usually lower than the market rate price at the 75th percentile. And that is the total length of the bar on this graphic. That's what the 75th percentile is represented by. The state's reimbursement rate is the amount that the states determine that providers can receive for a subsidized slot. For infants in center-based care, Kansas sets its base reimbursement rate at $774 a month, which is slightly below the 75th percentile target of $811. But what's not shown here is that the estimated true cost of providing quality childcare in Kansas is nearly $500 more than that per month. So in Missouri, the state's reimbursement rate is $789 per month. And on the graphic, it's the combination of the blue and the navy portions of that bar. And this rate is actually slightly higher than it is in Kansas, but it's substantially lower than the 75th percentile of the market rate survey, which is at $1,361 per month. So this higher market rate price is actually closer to the true cost of infant care in Missouri, which is estimated to be about $1,400 a month. Of the base reimbursement rate, states typically require the families to pay a portion of it, which is what is called the copayment. And the copayment amount is usually set based on a family's income and the number of children that are in care. In Kansas, a mom who works a minimum wage job is not required to pay a copayment, but in Missouri, the mom is required to pay $105 per month for each child, which is illustrated by the navy portion of the bar. In all but 12 states, providers can also charge families an additional fee that equals the difference between the reimbursement rate that the state sets and the price the child care provider charges to non-subsidized families. And in the graphic, this is represented by the teal portion of the bar. So a family's total out-of-pocket expenses for childcare equals their copayment amount plus that additional fee. If states' reimbursement rates are low relative to the market price, and this can leave families incurring a large fraction of the child care costs, or lead families to seek lower priced and lower quality care, or incentivize parents not to work. Okay, so with all the information, let's see how the roadmap policies interact to determine the level of resources a parent has available to them to provide for their children's basic needs. So in Kansas, the minimum wage is $7.25 an hour, which means that the mom earns just over $15,000 a year, or about $1,200 a month. In Missouri, the minimum wage is $10.30 an hour, which equals over $21,000 per year, or $1,785 per month. So based only on earnings, the mother has over $500 more per month to provide for her family in Missouri. But sadly, both families still have incomes that place them below the federal poverty level for a family of three, despite working full-time. This story really changes when we consider the out-of-pocket childcare expenses the mom has to pay in each state. In Kansas, the mom doesn't have to pay a copay, and the additional fee the provider charges her is relatively low at $49 per month for her two children. And although the mom's earnings are lower in Kansas, she gets to keep most of them, rather than spend them all on childcare. But in Missouri, the mom has to pay over $1,300 per month for childcare for her two children, or over $16,000 a year. This is 76% of her earnings. And these out-of-pocket childcare costs basically reduce the state's minimum wage from $10.30 an hour to about $2.50 an hour. Most people would make the decision either not to work at this wage level, or they would leave their children in less expensive and perhaps lower quality care arrangements. So now if we add in the federal nutrition benefits of SNAP and WIC, plus the federal and state tax credits, the mom has over $30,000 in resources in Kansas each year. But in Missouri, despite earning over $6,000 more each year, she ends up with nearly $8,000 less at the end of the year to provide for her two children. She is eligible for Medicaid in Missouri, which she is not in Kansas, which does help her with her out-of-pocket healthcare expenses. But an increase in the child care reimbursement rate to better reflect the actual cost of care would help the family even more. The temporary monthly child tax credit and refundable child independent care tax credit that was passed as part of the American Rescue Plan provides significantly more resources to the family. and they help to offset some of that out-of-pocket childcare expenses. But without federal action, these benefits will expire next year. The differences in resources available to families can be seen all across the country. And let's use 3 southern states as another example: Texas, Louisiana, and Arkansas, who border one another and often share a labor market in those regions of their state. So the full-time working mother would earn $7.25 per hour in both Texas and Louisiana, or just over $15,000 a year. And in Arkansas, however, the mom would earn 50% more than that, or close to $23,000 a year, because the state's minimum wage is $11 per hour. That's a huge difference in earnings and gives the mom nearly $700 more per month to provide for her family. But when we take out-of-pocket childcare expenses into account, the story gets more complex. Despite earning similar amounts in Texas and Louisiana, the Texas mom has to pay $531 each month in childcare expenses, which substantially reduces her earnings. Rather than earning $7.25 an hour, she's in effect earning $4.20 an hour after out-of-pocket childcare expenses. But in Louisiana, the mom doesn't have to pay a copay, and the reimbursement rates equal the market price, so she doesn't have any out-of-pocket childcare expenses. In Arkansas, there is also no copay, and that state doesn't allow providers to charge families an additional fee. So the mom doesn't have any out-of-pocket childcare expenses, and she can keep all of her earnings to provide for her children. The mom's SNAP benefits are somewhat lower in Arkansas than in the other 2 states because of her higher earnings. But at the end of the day, she has more than $35,000 in available resources for her family in Arkansas, compared to just under $31,000 in Louisiana and only $25,000 in Texas. So this example really demonstrates how state minimum wage and childcare subsidy policies interact to affect household resources. The temporary benefits from ARPA help to close these gaps a bit because the refundable child and dependent care tax credit helps to offset the higher childcare costs in Texas. But this credit is given to the family at the end of the year, and the mom has to come up with the out-of-pocket expenses up front. And this credit is set to expire next year if it's not made permanent. Again, this is the same family doing the same thing and what society asks of most families. But state policy choices lead to substantial variation in the level of resources the mom has available to provide for herself and her children. For a final example, I want to demonstrate how the same family would have nearly twice the level of resources if they lived in DC versus North Carolina. This example really illustrates how state policy choices add up to support families. In North Carolina, the minimum wage is the federal minimum wage of $7.25 an hour, which is less than half of DC's minimum wage of $15.20 an hour. The same mom working the same job would earn twice as much in DC as she would in North Carolina, or in any of the 20 states that still have the federal minimum. But the differences in resources grow even larger when we take out-of-pocket childcare expenses into account. In DC, the co-payment for the 2 children is only $68 a month, and DC doesn't allow providers to charge the difference between the reimbursement rate and the non-subsidized price. So the mom gets to keep nearly all of her earnings. But in North Carolina, the mom has to pay $126 per month in co-payments, but she also has to pay that additional fee to make up the difference between the reimbursement rates and the market rate price. This means that her out-of-pocket childcare expenses for childcare are over $10,000 a year, or 2/3 of her earnings. The federal and state nutritional benefits and tax credits that the mom receives each year are larger in North Carolina versus DC, but they can't close that gap caused by the lower wages and higher out-of-pocket childcare expenses in North Carolina. Also in DC, the mom is eligible for Medicaid and would receive 8 weeks of paid family leave, but she wouldn't have either of those benefits in North Carolina. The temporary ARPA benefits certainly help the family in each state, and especially in North Carolina, but it's the state's minimum wage and childcare subsidy policies that really drive the vast differences in resources the mom has across states. So our goal is to ensure that parents can work and care for their children and that they have sufficient resources so that they have stability in housing and food and income. But many families face barriers to work, and many working families do not have the resources they need to care for themselves. And as we can see from this simulation, this is a result of state policy choices. So if you'd like to see more about how your state's policy choices interact and the level of resources this family would have in your state, you can visit our website at pn3policy.org or contact me and my team, and we'll help provide more information. We are in the process of developing a family resource calculator to help states measure the impact that potential policy changes would have on a family's resources. And the tool will allow states to see how family resources would change if the state increases minimum wage or its base reimbursement rates or EITC, for example. And the hope is that with more information, states can make policy choices that will empower parents and ensure that children get off to a healthy start and thrive. Well, welcome. We are so excited for our second panel of the day. We are joined by four elected officials who have really done amazing work this past legislative session to push through policies in their state that are related to our roadmap policies, but also going to be such a benefit for the children and families in their state. We're going to be joined by Senator Claire Wilson from Washington, who has been a champion for child care policies, and the work that they have done in Washington this past legislative session is just truly remarkable. The state also has voted to expand its earned income tax credit and fund the earned income tax credit, which is really going to be important for its residents next year. We are also joined by Senator Cristina Pacioni-Zayas from Illinois, and she has been a champion for improving birth outcomes for moms, and especially reducing the huge disparities that we see by race and ethnicity. And in Illinois, they championed several different important initiatives this past year, and she's going to spotlight many of those initiatives. In particular, they expanded their home visiting programs, and they had a really big emphasis on group prenatal care. We're also joined by Senator Teresa Ruiz from New Jersey. And New Jersey, this also did quite a bit this past year. And one of the things that it did was voted to expand Family Connects and offer it statewide. It, along with Connecticut and Oregon, are the only states that have done this. And it's really exciting to see that this is going to be a program that is going to identify the needs that families have right from the start. We're also joined by Representative Stephanie Hilferty from Louisiana. Louisiana is really a champion in states with regard to its child care subsidies. And Representative Hilferty has been a huge supporter of early childhood. And this past year, she did a lot on improving birth equity and health outcomes for women by voting to extend Medicaid coverage to 12 months postpartum. And hopefully that's going to go through in the state. Anyway, I am so grateful that you have all taken time out of your very busy days to join us. And I know that folks are excited to hear from you. And so I'd like to begin by just asking you to introduce yourselves just a bit. And I'd like to hear from you why it is that you think that the prenatal to 3 developmental period is so important. Why are you interested in focusing on maternal and child health and making sure that our children get off to a healthy start and thrive? Senator Wilson, would you like to begin?
Thanks so much for having me here today. It's just absolutely a pleasure and an honor. And I would say my entire career has been focused in that realm as we think about return on investment. And I'll say that I started as a project director for WIC in a very rural community in Montana, and then moved to working with 11 to 21-year-old pregnant and parenting adolescents, where I taught parenting, and no fifth grader should ever be a parent. And so, thinking about where it is and when it is we can make the greatest impact. We know that it's early and with families. And so that birth to 3 space is critically important. And I, often say we're the only place in the world where you've got to do the wrong thing to get what you need to do it right. And if we actually were creating an equitable environment, we would start from the very beginning and we wouldn't have the disproportionality that we do.
Well, thank you for that. And Senator Pacione-Zayas, would you like to share with us why you are so committed to the early childhood development?
Definitely. Thank you for having us. This is really great to bring not only legislators together, but women legislators who are powerhouses in this particular work. I'd have to say, as a community organizer, I'm deeply rooted in the mantra that the revolution will not be televised because it's going to start with infants and toddlers. And that has really guided my work because essentially high quality early care and education, as well as the prenatal care that's necessary to set the foundation, that is a basic human right. And it is an opportunity for us to address systemic racism and other interlocking systems of oppression from the start so we can set up the human experience to be best out the gate. And so that's really what has motivated me to be able to translate my organizing skills to the state legislature and to bring communities along to the space and create additional seats at the table so that we're not on the menu.
Can you introduce yourself a little bit more and tell us why you're so committed to this work?
So I'm not sure if you called on me because you were muted for a little bit.
I'm sorry, I did. Senator Ruiz, I would love to.
Okay, good. I could read lips somehow. First of all, I don't know any. So there will be technical problems. I don't know any of these phenomenal women warriors here, but I am applauding you and I am loving you from the great garden state of New Jersey because the work that you are all doing is really just advocating for truth in policy. It's advocating for common sense approaches. It's recognizing that when we engage in sometimes uncomfortable conversations, the best outcomes will come out. So just repeating some of the same words: equity, changing the conversation to understand that as chair of the education committee, when I first came on, everyone really just talked about the ed space from a K through 12 initiative. And I really shifted the conversation to say, this is a conversation that's 0 to 16. So it is from infancy to career. Until you are a well-rounded tax-paying resident, our job is not done, right? And that begins in the womb. And so access to healthcare, access to appropriate living, access to employability, and the list can go on and on and on. As a first generation college student, I know for a fact that, you can go to your local store and buy a winning lottery ticket and that will change the trajectory of your life. Or you can walk into a school setting that's going to give you the absolute resourced opportunity for you to fulfill your 100% God-given potential. And that's where policy is critically needed to be sure that happens in an artificial way when it's not available inside of a household that's doing it on its own, not for lack of will or for lack of love, but just because there are other things that take precedence in that space. We know that access to high quality universal preschool is the greatest investment any institution can make. And still we have places where kindergarten is a half-day option. And so common sense has really been stripped away from this conversation. And now I think keywords that probably many of us for the last decade or so, I'm dating myself, I know some of you are way younger than I am, but places of spaces where I was talking about when I was running for office have become great target points. Universal preschool, access to childcare, et cetera, are now becoming huge buzz points. So I think the turning point for this country is now, and there is a real great space for us to make inroads ahead to be sure that women and children are resourced.
Well, thank you for that and your commitment to this work. Representative Hilferty, we'd love to hear from you as well.
Take notes. Can y'all? Oh, I'm muted. I apologize. Okay. No, I should be unmuted, right? Can you hear me?
Try one more time. Let's see, I think that you are muted, and we will be working with you to figure that out. My apologies, and I don't exactly know what's going on.
You're not muted.
I'm not muted. Can you hear me?
Oh, we can hear you now. Thank you.
Okay, well, I'll go on. Thank you so much. And what I was just saying is when I'm on these panels, I take notes because I think we all learn from each other, and I've already started taking my notes, and I'll be following up with y'all to get ideas and share ideas. So I actually came into this when I was elected. I was one of the first legislators to have one of the first female legislators, I should say, to have a baby during session. My daughter was born, Claire Marie was born in May during our spring legislative session. So I was thrown into the world of prenatal, maternal health, and early education in a hands-on, in-depth way. And I saw in those early years the difference, the way those children are sponges. They are absorbing everything around them and everything in their environment. And what that environment is so crucial, especially in those early ages. Now, what I think is interesting is in Louisiana, we have really tried to make the case that early education and workforce development are two sides of the same coin. And that is not just to say that, yes, if you put this child in early education from 0 to 4, in 18 years, they will become a productive member of the workforce. If you have a child in early education, you're allowing that parent to enter the workforce. So not only are you making that child's life better, but you're changing the dynamic of that entire family, which I think is so impactful. So I came to it maybe out of personal experience, but my passion for this and my passion for seeing a brighter future for Louisiana's children and families is what's really, kept me in this.
Wow. Well, thank you for sharing that. And I'd love for each of you now to share with us what some of your most proud accomplishments are from this last legislative session. We would have, I know you could talk about it pretty much all afternoon. Unfortunately, we don't have all of that time, but I am so excited to hear more about the things that you are really excited about that your state was able to accomplish this year. Senator Wilson, we'll begin with you.
Well, I am absolutely thrilled to talk about the Fair Start for Kids Act, which is really probably the biggest piece of landmark legislation and the greatest investments that we've ever made in the state of Washington, and been working on it from the outside for almost 40 years. So to be able to be the guide on the inside to make it come to fruition was absolutely fabulous. And really, there's a four-prong approach. One is stabilizing, expanding the industry. Second thing was making childcare more affordable. The third thing was making childcare and early learning more accessible. And then the fourth thing was really strengthening the prevention and intervention services. So we made great investments in increasing rates for providers, decreasing the co-pays for families. We have invested in $400 million in stabilization grants. Healthcare for providers, we increased our state-funded pre-K as well as early education, and really created some stable investments for our prenatal-to-3 population. So mental health consultation. We also were able to do complex needs, trauma-informed care, dual language rate increase, non-standard hours care, equity grants. I could go on and on. And we were able to also pass a cap gains tax, which is going to be the revenue source for funding all of this work. And I'm going to stop because there are fabulous other things that folks are doing, but it is a game changer for the families across the state of Washington.
That is for sure. We were trying to keep up and document all of the work that was coming out of that state, and it was very difficult to do. It's so impressive, and we're looking forward to just watching that play out over time. Senator Pasiones-Zayas, could you share with us about what you're most excited about that happened in Illinois this past year?
Most definitely. So I came into the legislature right before the lame duck session, which was essentially an opportunity to operationalize the call to action that the Illinois Legislative Black Caucus made in response to the murder of George Floyd and taking our protest to progress. And so 4 pillars were established to really address systemic racism at the root in the areas of education, health, economic opportunity, as well as, the 4th is escaping me right now. We'll get to that in a moment. But the point is that there was a specific health pillar, and one of the bills, HB 158, which is Public Act 102-4, is known as the Healthcare and Human Services Reform Act. That specifically had provisions in there that were responding to a report that came from our Illinois Department of Public Health on maternal morbidity and mortality. And we know, and I'm just putting in the chat right now a link to that report, we know that the whole country has the highest rates of maternal mortality among, more affluent or higher income countries. And we know that structural racism contributes to these particular outcomes as it relates to Black mothers. In many ways, we can see this demonstrated in that it's 4 to 6 times higher, that rate of mortality and morbidity, than it is for any other particular group. And so this particular bill was looking to respond to the call to action that came out of that report. And that was to really address the fact that we need to have some structural changes. So one of the things that we were able to put in there was a framework for Medicaid to be able to be utilized for covering doula services as well as home visiting, evidence-based home visiting programs. We also put a provision in there for our Department of Health Care and Family Services to be able to develop a credentialing system for doulas, as well as to consult with experts in the community about what that credentialing program would look like, along with a whole rate for payments. The other piece that I really want to kind of underscore is that there was a particular Blue Cross Blue Shield of Illinois has been supporting the expansion of Centering Pregnancy, which is an evidence-based, nationally recognized model for group prenatal care in select federally qualified healthcare centers across Illinois. And we know that this model includes a program in which pregnant women can receive routine prenatal care, childbirthing classes, and group therapy and personalized health assessments. On top of that, a grant was administered to expand this particular model over 3 years, really working with community-based organizations on the ground who know the nuances of each of their community, the layers, the complexity, and come with a culturally responsive approach to supporting moms, particularly moms of color. And so there are about 6 organizations that are recipients of this particular grant to expand this model, as I said, in a way that is culturally competent and responsive to linguistics adversity. The other piece I want to highlight was particularly looking at the workforce. I know we've been talking about it with respect to, families and being able to afford childcare and high quality childcare. But I specifically introduced and carried a bill that would establish an early childhood higher education consortium. And what this consortium would do is basically have all public 2- and 4-year institutions enter into an agreement to coordinate efforts to remove the barriers for our incumbent workforce to be able to meet their educational goals, whether that be a credential, an associate's degree, a bachelor's degree, or a master's degree. But we specifically prioritize the incumbent workforce because we know that they are the least paid, and we also know that they often experience so many barriers with trying to complete a degree. And so this agreement is going to provide scholarships, as well as student loan relief and wraparound supports and navigators to get them into programs and through programs. And I was really pleased that we were able to allocate $200 million of our ARPA funds towards this effort to stand up the consortium, as well as to provide the scholarships and the debt relief for students. So those are some of the highlights of this past session that I was really proud of.
Well, you have a lot to be proud of. It's really impressive. And the focus that you put on health equity is something that I'm hoping that other states will really pay attention to, because you're really a leader in that area. And I appreciate the work that you did there. Senator Ruiz, I'd love to hear more about what you're proud of that New Jersey accomplished this past year, because it was also quite a bit.
Yeah, I think we could talk for 2 hours on what the Garden State did, but some of the things that we did kind of tied and around it, and then I'll focus specifically on one bill at the end. So obviously we were in the midst of a pandemic, and one thing that we had to really do time on task quickly was that we teachers turned their living rooms into learning labs, and the mothers at homes and families at home to turn kitchen tables into the classroom environment. But everybody did this in a space without recognizing that not all families were resources that didn't have access to broadband, didn't have access to technology. And so I really led a huge charge in an advocacy platform to be sure that people understood that while you think this is an easy fix, when you do not have a computer, or you could have 3 children at home just with one tablet, that things weren't going to be, that the starting line yet again gets pushed further back for the families that I represent. And so within a time frame, even though it took longer than I would have liked, we connected all of our families. And today, if in fact, and God willing, we will not have to do that, but if lights get turned out in a classroom, that accessibility switch is turned on in households so that child doesn't get left behind in that space. We added millions of dollars into the fund to continue to expand universal preschool, which I said I will retire from the legislature if in fact we get to that point. And the governor said he had a 10-year plan. So I guess I'm on a decade trajectory to get everything I need to get done before I leave my space. But the greatest bill that I think got the most national attention was a bill that was part of the maternal health care package here in the state. And quite frankly, when I wrote the bill, it didn't come from that lens. Like Stephanie, I'm the first woman in the entire history of the state of New Jersey to give birth in the Senate, which speaks volumes about the lack of women and the age demographic in representation. And so I have a partner at home. I speak the language. I advocate. I can call on friends and family for advice. My life completely changed when I had a nurse lactation specialist come and visit me after I gave birth to my daughter. And we all know that newness, you're questioning everything to the point you question it so much, you're so engaged in the child's health that you lose sight of what's happening to yourself. And I was committed to nursing her as best as I could, but I was always wondering if I was giving her enough. And the nurse stripped her down, weighed her, then asked me to nurse her, and then weighed her again and said, "You did it. You just gave her a few ounces." And for women who nurse, a few ounces during those few early days is an extraordinary thing. And everything just changed for me. And I knew then that if in fact someone like myself, who I'm a huge advocate for myself and my family, if I needed that support system, what does it say to a single head of household who doesn't speak the language, who may not have the resources? And I wanted that experience to be the same for every single person. Now, New Jersey has a phenomenal Family Connects program, which has a nurse almost become part of the extended family, but it is only established for women who are in a specific economic rung, right? And so what we did was really scale this up. Moving forward, every single parent who brings a newborn home would have at least one visit, if not 3, in the postnatal scenario to answer questions, to connect to resources, to check in on that parent and the mother, because we lose sight of our own healthcare because we're so focused on the child. And while I did that, it clicked the day that the governor signed the bill when the woman to the left of me said, when my nurse came to visit me and took my blood pressure, I was immediately immediately diagnosed with post-preeclampsia. And if it were not for that visit, I would not be here for my 2 children. And so just extraordinarily proud of that moment. But I want to say this because it's important to have women in office, because if it were not for the experience that I had that lent itself to writing this bill, all these great intended consequences would not have come out. I tried to squish it all in there.
Yeah, I think that what you said about having women who have had these experiences be able to represent others and advocate in our houses of, in state legislatures is just so incredibly important. And the story that you shared is just, it's really touching. And I'm so grateful that this is going to be a program that everyone's going to have access to in New Jersey. I remember being shocked they let me take my children home with me. I thought someone's got to look at this whole thing. And again, I'm someone who studies child development and knows quite a bit, but I was unprepared the way that most new moms are, and such an important program. So thank you for doing that. Representative Hilferty, I know that you have a lot to be proud of from this last legislative session, and would love to hear about the work that you have been doing in your great state of Louisiana, which is my
certainly. And to just follow up on what Senator Ruiz said, I had goosebumps at that story. I mean, I just think that is so true, and connecting families with these resources, and especially not necessarily in the hospital when the mother has a million things going on. So I think that's really interesting. Some of the things we did this past session, this was actually a fiscal session for us in Louisiana. So there was a limited bill count of general bills, but we were able to get dedicated early education funding through our sports betting, which passed this year. So a portion of the sports betting money going to the state will go to early education. Additionally, we passed a bill, and it relates more towards getting adults scholarships, or not scholarships, a scholarship to get a certification or an additional degree that puts them into a direct career path. What we said at that point was some of these adults are going to have a 1 or a 2 or a 3-year-old in the home. And if that child does not have somewhere to go, this adult cannot go and achieve that certificate to then get the job to become a welder or whatever the case may be. So we actually are starting a pilot program where early education centers near some of our community and technical colleges will have spaces for those children. So while mom or dad's at school, the child's at school in that slot. So I think it's a nice tie-in. It shows the direct tie-in for workforce development and early education. One of my colleagues, Representative Willard, passed midwifery and doula coverage through any insurance offered within the state. And then one of my colleagues, Representative Landry, and I both worked, it was her bill, and I was a co-sponsor early on, to extend postpartum coverage to 12 months. We actually got this through the House with bipartisan support, which was a really good thing. I mean, we had people from both sides speaking in support of this bill. Unfortunately, we weren't able to get it through the Senate. I've already talked to Representative Landry. She plans on bringing the bill again, and we certainly plan on trying to move that effort forward. So those were a few of the things that we did during this past year.
Well, it's obviously so impressive. And the idea of thinking of childcare and workforce as 2 sides of the same coin, and this 2-generation strategy, it's so important. So thank you again for the great work. But you guys, this past year has been unlike any other. And I would say this time last year, you were probably all wondering what your state budgets would even look like, whether you would have to scale back and so forth. To what extent did COVID and the pandemic kind of allow you to accomplish your goals, and what were the challenges that it kind of created for you? Senator Ruiz, you talked about the challenges it created for families and the work that you did to try to address some of those challenges. So maybe you could start to just extend on the extent to which the pandemic made it more difficult or actually facilitated the ability to really move forward with efforts to support families and children this year?
So the one thing I will say, and I repeat this all the time, the pandemic gave power to my agenda, right? The things that we're talking about today, I've been screaming about sometimes alone 10 years ago: learning loss, accessibility to resources, equity in our school systems, implicit bias. I mean, all things that people were forced to reckon with during a pandemic. And so what really happened during this time frame was individuals who didn't think that it was important because it wasn't happening in their own respective backyards had a coming of truth, and honesty that they were forced to deal with in the mirror. And so what I think it's offering us now is an opportunity to really effectuate change in an honest space. So we have two choices here, and this is not unique to New Jersey. This is something that the country has to reckon with. These are the truths, and we're going to roll up our sleeves and have uncomfortable conversations about who we really are and create policy, or we're going to continue to do what we've usually done in the past. And I hope we're not losing sight of things, because when things start getting better, folks want to just forget like it never really happened. And I people laugh at me all the time because I coined this phrase, the Scooby-Doo syndrome. And anyone who ever watched that cartoon, the Scooby-Doo would take off, but he would stay running in the same place. And bureaucracy and policy is very much like that. You just keep doing the same thing over and over again in the same way. The pandemic has told us that learning loss is a real thing, that my Black and brown students have been facing this since I can remember, that New Jersey is reported as the #1 public school system in the country. But I know for a fact that that's not something that every single student can hang on a banner outside of their school building. That this country as a whole pretends to have said they're making investments in education, but we all know that's a lie. When I walk into a building in my district that was built under Abraham Lincoln's administration, we cannot pretend that we are truly making investments in children, in women, or in our education infrastructure. And I mean human capacity in that sense, when we in fact do not recognize that education is the greatest civil rights conversation that we should be having right now. And it is a constitutional right that every one of us has in this country, whether we were born here or not. And that if in fact we don't engage in that space in a real honest way, then we're going to lose an opportunity that I believe right now that we have with all the federal funds that we have in place to bridge the achievement gap once and for all.
That phrase that the pandemic gave power to your agenda is really something that is very telling, that these are not necessarily new problems at all. It's exposed a lot of the problems that already existed, certainly exacerbated some, but thank you for sharing that. Senator Wilson, how has the pandemic played into the work that you've done in Washington and the state's success there?
First, I was just going to say amen with what you just said. So just saying, this is a gender equity issue that's been brought to light as well. So as well as being an issue around, racial equity and social justice, it's also an issue that we know the pandemic has hit women much harder, not only on the industry side, but also as females in the fields who have often left their jobs. And I would say, number one, I always say I walk with privilege, and I know that, and I will use that privilege in every single room, not to be a voice for others, but to create the space and get out of the way so we can make the changes that other people know need to happen. I don't have the answers, but I do have a door. And so I believe that, economic recovery begins with investments that we made. And the other piece is I speak very clearly that childcare and these issues are no longer poverty programs, and we're still looking at them as if there's only a certain segment of our population that needs them. I will never forget that certain segment of the population, and we will always need to make sure we have equity and access. But also it was an incredible opportunity to take what I would say is individuals of privilege who suddenly had an urgent crisis on their hands that they've never had before. They could always purchase what they needed. They always had the resource that they needed. And suddenly we're in a space where they couldn't buy a diaper. They couldn't buy a spot in care because it didn't happen to them and it wasn't there. And that all of a sudden school stopped and that people suddenly realized that school was the care setting for so many of our families and so many children. So it was an wonderful opportunity to take the privilege, but make sure the impact was on those furthest from opportunity. So that really was a piece for me. The other was that pandemic touched everyone, and that because of the urgency, it was an opportunity to make movement in things that had been worked on perhaps before, but there was never a sense that now was the time. So now was the time, and it was done all virtually. And I think, again, we had greater understanding and empathy, and that moved the state to action and also to knowing that we needed to figure out some revenue to keep this going.
Yeah, I think that it really did just make it the prime time to take advantage of all the things that we know need to happen. Representative Hilferty, what about in your state? How did the pandemic play into your goals and the efforts and the success or challenges that you faced this last year?
Certainly, myself as well as a few colleagues, we have been beating the drum of a greater investment in early education and specifically towards opening more seats. So the way our state's early education is funded, and this goes back several years to Melanie Bronfman and now Libby Saunier, who do amazing work in our state. A lot of our funding is geared towards our in-need 4-year-olds. So we have almost 100% participation for pre-K for our in-need 4-year-olds. What that does, though, is it leaves less money for our 0 to 3-year-olds. So several legislators, as well as myself, have been focused on increasing that investment. I think what we did see during the pandemic, which did make it difficult, is that the Department of Education got substantial funding federally for K through 12, as well as for early education. Now, this was limited funding and cannot be used to increase seats. But some of that gets lost in translation when you're saying, hey, we have a, $100 million ask for additional seats. And they're looking at what you've just, what the department has gotten for early education. So I think there were challenges in communicating how that money could be spent that was coming federally, what it could be spent on, that it cannot be spent to expand seats in many cases. And so that was a challenge we faced because we are constantly looking to see how we can get more of Louisiana's children, especially 0 to 3, because many of our 4-year-olds are served into early education slots. So we've looked at creative ways, like I mentioned, with the community college program to try to expand seats in very targeted ways for that 0 to 3-year-old segment.
Yeah, I think that all of the funds that have come from the federal government through both the CARES Act and the American Rescue Plan Act have been a challenge for states, a welcome challenge, but
we're very grateful.
So I can really appreciate the care that you've been giving to try to figure out how to maximize those investments and improve outcomes for infants and toddlers. Senator Pacione-Zayas, what about you? How has the pandemic shaped your work this past year in Illinois?
Sure. When the pandemic hit, I was actually serving on the Illinois State Board of Education, and I was also on detail for the governor to create on-demand webinars for all of the emergency childcare providers that kept their doors open. They never shut down. And that kept me awake at night to make sure that we had very accessible, straightforward information that would help them understand what the safety protocol would be, but still attend to the social emotional needs, the child development needs. Anyways, I say all of that so that when I was sitting at the State Board of Education and we're trying to figure out what's happening, how are we going to respond, I really anchored my advocacy in the issue around deeper investments with infant early childhood mental health, because I knew that the toll would be tremendous for children during this period. And I carried that with me as I moved over to the Senate. And therefore, we did a lot of work to make sure that we expanded our infant early childhood mental health services, as well as our registry within that. I think the other piece that came to light was a piece that Senator Ruiz spoke to in terms of access. And so we really worked deeply in terms of codifying telehealth for early intervention so that could be a permanent choice should parents choose to be able to have access to these interventions, as well as to extend early intervention to the 3-year-olds who turn 3 over the summer months. For us, that becomes a huge conundrum, and they really struggle to make that connection into the school district. Of course, I'm looking to even expand it earlier, so I will be pushing on that. And then I think the other piece that really drove me is around, again, the workforce, going back to the workforce, knowing that they literally kept us together during the pandemic. We would not have been able to function in any sector had people closed their doors in Illinois. And so on top of the restoration, as well as what we're working on our stabilization grants, we also offered hero pay. And that really gave me a lot of, because I was doing the webinars, because I was seeing how this was affecting them, I was able to then really push forward on the need to ensure that we stopped exploiting the labor of our early childhood workforce, who are predominantly women of color, immigrants and refugees, and that this is an issue that is not only a gender equity issue, this is a racial equity issue, it is an economic equity issue, and we did not have any more excuses to not act. So that, in many ways, I definitely resonate with what Senator Ruiz said, in that this was the do or die moment. No more excuses. Let's get the work done.
Absolutely. Absolutely. And caring for the workforce, the amount of burden that they've been under this past year and what they've done to keep our economy afloat has just been absolutely amazing. And we have to do more to support them moving forward so that we can actually rebuild our economy, as you said. So I want to give each of you just a final word on what your goals are moving forward. You accomplished a lot this past year, and I'd love to hear more about what is exciting you and your goals are for this next year and beyond. We'll start with Senator Wilson.
Well, I think implementation is one of the most important things as we push things out, because we were able to move from the federal poverty level to the state median income and increase accessibility for many families. And so those that have been on a cliff, so to speak, or have been pushed out of the system, we need to make sure we reach out and bring them back in and invite them back in, because they're now eligible for that. Myself, right now, the biggest issue for me is salary parity as we think about our systems. And that, interestingly enough, 1,000 to 2,000 days is paid very differently than 2001 days and beyond. And I am not necessarily, nor am I saying we have to have a definition of basic ed in K-12, but we clearly need to value the work that our early care and education providers do, and think about how it is that we don't create pathways to poverty, but we create pathways so that individuals who care for our youngest learners are also able to sleep at night and know that they can live and dream just like anyone else who makes a living wage job. So that is my big piece of work. And I'll say across the states, it seems as if pre-K is always the piece of work that people look at when we think of salary parity. But I'm not willing to just slice off another group. I really believe we need to look at that full continuum of care prior to kindergarten to think about what that looks like. So that's the next big piece of work for me.
Well, thank you. And your commitment to the prenatal-to-3 period is just so important, and not forgetting all the work that we need to do to support our families before they even get into pre-K, much less into kindergarten. So thank you for that. Senator Ruiz, what do you have on your horizon? What are your goals moving forward?
So I would love to finally see a bill that I introduced probably 2 years ago, is to create the Department of Early Childhood so that there's a unique focus and lens so that the 0 to 5 space has its own kind of agenda and doesn't get mixed up in the traditional K through to 12 space. I would love to see that come to fruition, and just more so that all of us here who know that we work in government, if you're ever trying to open up a child care center, it is not only at the Department of Education, it is with the Department of Community Affairs and the Department of Health. I mean, it's an extraordinary space that touches many levels of government. So I would love to see that there. I have a huge bill package to help address teacher shortages, which now is another hot topic issue, but bills that were drafted before the pandemics in specific areas as ESL, English as second language, and in our special ed spaces. We know that every state here, we could all probably raise our hands that we have a shortage of bilingual teachers and special ed teachers across this entire country. But the focus for me outside of any actual policy is going to be accountability and making sure that there is a public lens on what's happening. By accountability, I mean, are we doing that checkpoint measure? Our students lost a year of testing, and that's critically important, not to test for purpose, but to test to see what the real picture is and how we're going to make sure that that child can succeed. And also to see where is this federal money going, and are we pouring money and getting a return on that investment?
Yeah, that focus on accountability is also a way to really focus on equity to make sure that our policies are reaching those who need them the most. So I really appreciate all of the work that you have done and what you're going to be doing moving forward. Representative Hilferty, would you love to share with us or we'd love to hear from you about what you have on the horizon? What are your goals moving forward?
Yeah, thank you. And thank you for including me. It is truly an honor to be with a panel of such accomplished women legislators. I think definitely there will be the movement to extend postpartum coverage that we saw this year. We will be bringing that back. We will be again looking to find funding sources to increase our number of seats for our 0 to 3-year-olds. That has been a continued effort, and I think we will continue to do that. And ironically, I got a text from one of our partners as I'm sitting here that Libby Saunier saying that Family Connects is, we're looking to try to do some pilots with that. So it's just so nice to see these things come full circle. But no, again, looking at our maternal health outcomes and specifically as we extend that postpartum coverage and expanding our number of 0 to 3-year-olds, we are so grateful for that federal infusion of dollars towards our early ed. And we just need to see how we can increase that stateside investment.
Yeah, that's great to know that there's so much on the horizon coming and your commitment to it. I appreciate that. Senator Pacione-Zayas, would you like to close us out with what it is that your goals are moving forward?
Yes. So 3 of them, one of them I've heard my colleagues here say, and that is the compensation piece. We can't create these educational pathways without leveling up the compensation because what's the point of getting a degree if you're not going to get any type of increase beyond a poverty wage? So I'm definitely looking to identify how can we take what we did with the hero pay and actually make it a lot more meaningful, as well as institute it within our infrastructure so that it has a dedicated revenue source. And I know some of my colleagues may have been exploring and have actually been talking about how we might use sources such as cannabis revenue to think about that. I'm going to just plant that seed. The other piece that I'm looking to advance is really to support and sustain our mixed delivery system. Our community-based providers are literally the anchors for our communities and are set up to wrap around an entire family multi-generationally. And in many ways, they took the largest hit during this pandemic. And so I think ways that we can ensure that they get a fairer share of our early childhood block grant would definitely be one of the areas that I'd look to support, and especially with looking at what this federal proposal is starting to put out there with ensuring that our states have strong mixed delivery systems. And then I think the last piece, our our state had a funding commission that really looked at how are the ways that, to Senator Ruiz, how can we consolidate and centralize all of our pieces of the early childhood system that are fragmented, that are disparate, and put them into one space so it's a lot easier for families and communities to access. And so there's some pieces that are moving on that angle administratively, and I look to support that legislatively. And within that, but we're starting with actually ground up work, and that's establishing regional hubs to actually make up for the fact that we lost a lot of children participating in our programs. And so we need to get them back on the rolls, but we need to do that with community, not for community. They need to lead that process, and we need to support their capacity building to do that. And so I'll put in the chat, there's some resources that Illinois, I'd love to share with all the wonderful colleagues that are here, that Illinois is using to kind of guide this particular work.
Wow. Well, thank you to all four of you for the incredible work that you're doing for families and our littlest ones. And it's really impressive to see this bipartisan support for supporting this really important developmental period. This is not something that is happening just in one state. It's not happening just within one party. It really is a testament to how the recognition that this developmental period has now, and your leadership in this area is so important. And I really appreciate, again, you joining us today. So thank you so much.
Thank you. Thank you.
As I've said previously, the Prenatal-to-3 state policy roadmap identifies the most effective policies and strategies that states can implement to empower parents and support the healthy development of infants and toddlers. And although I strongly stand by the comprehensive reviews that we've conducted to determine which policies are the most effective to date, I also recognize that there are limits to the evidence base. States are doing many innovative things that have not been rigorously studied, and they need to be. So we're constantly reviewing the evidence base to learn more about what works, and importantly, if the policy works equally well for all race and ethnic groups, or if it helps to close the persistent disparities in opportunities and outcomes. My colleague, Dr. Abby Lane, who leads our clearinghouse team, has joined us to share more about the work that they are doing to build the evidence base.
Thank you, Cynthia. I'm Abby Lane, and I lead our clearinghouse team at the Prenatal-to-3 Policy Impact Center. Our policy clearinghouse aims to serve as a resource that policy leaders, scholars, advocates, and funders can turn to for comprehensive reviews of the evidence on state policies and strategies that aim to strengthen outcomes for infants, toddlers, and their families. Our team of policy analysts conducts comprehensive, systematic reviews of the evidence to identify what we know and need to know about state policies and strategies and their demonstrated effectiveness at creating the conditions in which young children and their families can thrive. Our state policy roadmap tracks state progress on the 11 most effective policies and strategies that we have identified to date. However, a major aspect of our work is building the evidence base, and as we continuously review more evidence, our goal is to add more policies and strategies to the roadmap that improve the well-being of infants, toddlers, and their family. We know that states are currently implementing innovative policy solutions to improve conditions for families during the prenatal-to-3 period. Many of these policy solutions have strong theories of change, and we are looking for more opportunities to understand the innovative approaches that states are using, how these policies are implemented, and learn what rigorous evaluations can tell us about their short and long-term effectiveness. Beyond the 11 policies and strategies included in the roadmap, our clearinghouse also includes reviews of policies and strategies that need further study. Although some of these policies may be promising, these policies aren't yet on our roadmap because the evidence is insufficient. They have not been studied in the prenatal-to-3 population or have not yet been rigorously evaluated. We plan to continue to review new policies to learn more about what the evidence can tell us about their effectiveness so far. We have a long list of policies to watch, policies that we think may have the potential to effectively improve the lives of infants, toddlers, and their families. But we need more rigorous evidence before these policies can be added to our roadmap. Earlier this year, the American Rescue Plan Act of 2021 included a temporary expansion to the federal child tax credit that makes the credit more closely resemble a universal child allowance due to the ability of parents to receive monthly payments and because over 90% of children in the country are now eligible. Although this credit is a federal program, evidence from the study of state-earned income tax credits tells us that states matter, both for the way states can help individuals access federal credits they are eligible for, and in building on federal tax credits by introducing complementary state-level credits. As the rollout of the expanded child tax credit continues, we hope to learn more about how states can help eligible people access the credit and better understand its impacts on prenatal-to-3 outcomes. Another policy to watch is the use of baby bonds, or a policy where every child covered within set eligibility guidelines receives a publicly funded trust account with a certain amount invested at birth. Over time, the fund grows in values, and when the child transitions into adulthood, they can access the fund, typically for education, to purchase a home, to start a business, or to save for retirement. This year, Connecticut began to implement the first statewide baby bond program, automatically enrolling children whose births were covered by the state Medicaid plan. Other smaller communities have implemented baby bonds as well, and we are excited to learn more about the short-term effects of the program, such as how families change behavior knowing children have savings, and longer-term impacts in the years and decades to come, including any reductions in the racial wealth gap. We are also monitoring state-level policies that affect parents' ability to work. Research shows that unpredictable work schedules are associated with financial instability, reduced physical and mental well-being, less time spent with children, and difficulty securing consistent, high-quality childcare among working parents. To reduce difficulties associated with unpredictable work schedules, recently enacted policies at the state and local levels have aimed to promote fair work scheduling among hourly employees by requiring advance notice of schedules, allowing employee requests for schedule flexibility without repercussions, and requiring guaranteed pay for hours on call. Recent rigorous research out of Seattle is promising, but further research is needed to understand what aspects of fair work scheduling are most effective for improving outcomes for workers and their families, especially at the state level. Another area we are watching is state-level action on housing policy. Although much of housing policy is determined at the federal or local level, there are still ways states can impact the stability of housing, which is critical for the well-being of infants, toddlers, and their caregivers. We are working to better understand what states can do in this area, particularly around reducing evictions, such as the right to counsel. In addition to building the evidence base on policies not yet on the roadmap, there are also state-level changes happening now that can tell us more about our existing effective policies. For example, as of October 1st, 7 states have a program in place or have passed legislation to enact 12 weeks of paid family leave to be available in the coming years. The current evidence base draws largely on evidence from policies providing only 6 weeks of paid leave. Similarly, many studies demonstrating beneficial impacts of higher state minimum wages have examined minimum wages up to the $10 per hour level, but many states will have implemented minimum wages of at least $15 per hour by 2026, based on scheduled increases in current legislation. As states implement more generous policies, such as with paid family leave and state minimum wage, we can learn more about the effectiveness of these policies at different levels and in different contexts to better understand the thresholds necessary to maximize benefits to families while minimizing any potential negative effects of these policies. States also have policy leverage to affect how easily parents can access federal nutrition benefits, which has implications for families' ability to access needed services and promote physical health and well-being. For example, similar to the choices that states can make to reduce administrative burden for the Supplemental Nutrition Assistance Program, or SNAP, as covered in our roadmap, states can also make policy choices that affect families' ability to access the Special Supplemental Nutrition Program for Women, Infants, and Children, commonly known as WIC. States can streamline and improve eligibility determination by improving coordination between programs and make choices like allowing full-year certification and the acceptance of electronic documents to make the application process easier for families. States can also make policy choices that improve the cultural inclusivity of WIC, modernize technology, and leverage community partners to improve program awareness and nutrition education. States are also increasingly supporting doulas as a way to provide physical, emotional, and educational support to parents before, during, and immediately following childbirth. Doulas may be particularly important for pregnant people of color, who have greater odds of adverse birth outcomes. Doulas provide patient advocacy during labor, which should reduce the likelihood of miscommunication or biases affecting the quality of medical care a patient receives. States can expand patients' access to doula services through Medicaid funding, but currently only a handful of states allow Medicaid to reimburse for doula care, and these states reimburse at different levels. Observational studies to date have found positive impacts of doulas on birth outcomes. However, to better understand these impacts and how best to implement doula support at the state level, more rigorous research is needed. Also affecting well-being in the perinatal period is access to health insurance. Medicaid coverage for pregnant people typically only lasts through 60 days postpartum. In the past year, 25 states have taken action to extend the postpartum coverage period through either a new provision in the American Rescue Plan Act, a Section 1115 waiver request, and/or with state funds. We are watching for rigorous studies to understand the impacts of continuous healthcare coverage during the perinatal period on access to healthcare and indicators of parent and child well-being. Over the last few years, another area that has often gotten more attention and state investment is state support of infant mental health specialists. Existing research into coaching and early childhood mental health has often focused on 3 and 4-year-olds. But as the early childhood mental health field continues to grow and include more services for infants and toddlers, we are watching for more rigorous studies analyzing the most effective programs to improve infant mental health. Critical to this research will be better understanding the most effective way for states to support infant mental health work, such as through statewide positions or offices dedicated to infant mental health, or through grant or Medicaid funding to support new and existing programs and services. With the infusion of significant funding to support early care and education during the pandemic, we also have an opportunity and an obligation to learn more about the effectiveness of state policies in the childcare field as states make changes to childcare subsidy programs, such as changing income eligibility thresholds, increasing provider reimbursement rates to cover a greater share of the true cost of providing care, and reducing or eliminating co-payments for families. We need to know more about what works to improve affordability, accessibility, and the quality of childcare for families. To better support our workforce, we also need to understand how funds, either through the American Rescue Plan Act or other state-level funding, can be used to boost the pay and improve the well-being of the individuals who do the incredibly important work of providing a nurturing and safe environment for our children while not in the care of their parents. What I've described is just a few of the policies we are watching, looking for state innovation in these areas and research to teach us more about the causal impacts of these policies and how they can create the conditions infants, toddlers, and their families need to thrive. We are also looking to learn more about the cost effectiveness and return on investment of these strategies to better understand the full impacts of these policies. We are also critically in need of research that demonstrates if and how our roadmap policies and strategies and other state policies not yet on the roadmap can reduce disparities in outcomes between racial and ethnic groups and improve equity in our states. We want to recognize all of the important and exciting work states are doing, and we encourage states to innovate and evaluate the policies they implement so that we can learn more about what works to improve the well-being of infants, toddlers, and their caregivers. We look forward to continuing to learn with you in the year ahead.
Thank you, Abby, out in California, for all the great work that you and your team does. Well, we are nearing the end of today's event, and I want to thank you again for taking time out of your day to join us and for all you do to support infants and toddlers and their caregivers. We're excited to share the new roadmap and that it's ready for you to use, and we hope that it proves to be a really valuable resource. My team and I are available to provide your state with any information that might be useful for you, and we would love to come and visit you and learn more about your state's goals and go through your roadmap data together. So please reach out to us. We also invite you to attend the 4 deep dive workshops that we're hosting throughout the fall that build on the information that we're providing here in the roadmap. Had we been able to host you in person, these would have been the plenary panels at the event, but instead we're hosting 4 separate events that we hope that you're going to be able to attend. You can sign up for them now if you scroll down to the links on the page you're watching, but we'll send out more information, I'm sure. On October 20th, we'll be joined by Don Moynihan and Pam Hurd to discuss how states can reduce administrative burdens to increase access to benefits among those who are eligible for them. Administrative burdens have huge implications for equity because they fall disproportionately on families of color. On November 3rd, we'll discuss how states are maximizing the use of Medicaid dollars to fund several of the effective roadmap strategies, including comprehensive screening and connection programs, group prenatal care, home visiting programs, and early intervention. Now, on November 10th, we'll discuss how the roadmap policies can promote greater equity in opportunities and outcomes in the prenatal-to-3 period. And finally, on December 1st, we'll discuss the logistics of implementing a paid family leave program with regards to how to design and fund and administer it. It's possible that the federal government's actions will make some of this moot, but implementation will remain a challenge that states have to grapple with. And so we're going to begin that discussion. So I'd like to thank you again for joining us to learn more about how states are investing in the prenatal-to-3 period to empower parents and to support children from the start. I have been incredibly impressed by the level of activity that we've seen in states this past year. And we're going to be tracking progress moving forward. There is still so much work to be done, however, but we have to celebrate the accomplishments that we've made. The pandemic has both exposed and exacerbated many of the challenges that families and providers in our systems experience. And I have been heartened to see folks coming together to try to address these immense challenges. I'd also like to thank the wonderful organizations that fund and support our work, including the Pritzker Children's Initiative, the Buffett Early Childhood Fund, the Ballmer Group, the Valhalla Foundation, the Klingenstein Philanthropies, and the Hemera Foundation. And also a special thanks to our National Advisory Council members whose guidance and feedback has been really invaluable to me and my whole team. Thank you also to our technical partners who have helped us with the website, the videos, and this production. Their skills and professionalism has really been wonderful. And finally, wow, thank you to my team. I am so grateful for your dedication and brilliance and hard work. And I'm excited for the work ahead of us. But for the next few days, you should take a well-deserved break. Thank you all again, and I hope you all have a wonderful afternoon.